Hello everyone and good morning to this meeting of the Adult Services and Housing Policy Scrutiny Panel. Good morning. I'd particularly like to say good morning to any members of the public that are viewing this meeting. Sorry, is someone else about to join the meeting? Getting a blossoming sound to suggest that there is. Right, can I remind members, though you are perfectly aware of these rules by now, that we are using Microsoft Teams software to enable this virtual meeting. It's important to note that this meeting is being held in public in as much as we are streaming today's meeting on the internet, and members should act accordingly. The YouTube link for the meeting was published with the agenda, and a recorded version will be available to view on the North Somerset Council website within 48 hours. Okay, is there anything else I need to highlight, Leo? If not, can we proceed to the roll call?
I think you've covered it all, other than the usual virtual meeting etiquette, which I'm sure everybody now is well aware of.
Yeah, members, I hope you'll join with me, and I think one of the things that's important is that whilst you switch off your microphones, if you're not speaking, I think it's important for the public that our faces do remain in the frame. Let's treat it on that basis. I see that Councillor Keating is about to arrive, so once he's in, perhaps, Brent, you could begin with the roll call.
Thank you, Chairman. All right, the roll call. Councillor Crosby.
Present.
Thank you. Councillor Butte.
Present. Sorry, I'm present.
Thank you. Councillor Cato. Thank you. Councillor Briggs. Councillor Harley.
Present.
Thank you. Councillor Harrison.
Present.
Thank you. Councillor Hearn.
Present.
Thank you. Councillor James.
Present.
Thank you. Councillor Keating.
Present.
Thank you. Councillor Tucker.
Present.
Thank you. And Councillor Willis. Okay, and Georgie Bigg.
Present.
Thank you very much. All right, Chairman.
Thank you very much, Brent. Thank you. Right, let's begin. First item on my agenda is the election of the Vice Chairman, new Vice Chairman, replacing Councillor Cherry. I propose that Councillor Hugh James is elected as Vice Chairman for the committee. Are there any objections? None. Thank you. There you are.
Chairman, just to follow correct procedure, do you have a seconder?
Oh yes, of course it is a full motion, isn't it? Who will second it? Sandra, thank you. Seconded. Carried. No objections.
Thank you very much.
Jolly good. Right. Congratulations, Hugh.
Thank you very much. Look forward to working with you.
Hello.
Hello. Thank you very much. Look forward to working with you and continuing the work on this panel.
That's great. Thank you. Right. Item 2, public discussion. Are there any comments from the or requests for participation from the public?
We've had no request to speak notified, so nothing.
Thank you very much, Leo. Item 3, apologies for absence and notification of substitutes.
I've had no official apologies, though Councillor Grigg has said that she will be a bit late today, so she will be turning up, but about half an hour late, I understand.
Thank you very much. Thank you. Would you excuse me for just 20 seconds? I need to close the door. The door is closed. Right. Item 4, declaration of disclosable pecuniary interests. Any? No. Right. Minutes from the meeting of the 5th of November 2020. Just one item. I'll just touch upon it quickly on that. I noticed in the conclusions that the panel's support for the establishment of a carers champion be referred to the executive member. Very briefly, it has been referred to the executive member, and he is going to inform us, when appropriate, what steps may or may not be taken with respect to that particular position. So on that basis, I propose, are we satisfied that the minutes are a correct record? Seconded?
Yeah.
One, Sandra, thank you. Approved.
Chairman?
Yes, Chair. Yes, Anne.
Can I just get some clarification, please? Because as we go through the agenda, when do you want questions asked? When you're going through the pages, or do you want it at the end? Because it's always very difficult when it's at the end, because, you know, we have to write down what we're going to ask. So I think page by page or whatever is much easier.
Stan would be page by page.
Okay, thank you.
Okay, thank you. I appreciate, and I think what Councillor Harley has highlighted is that we have a busy meeting to get through. I'm sure you've all read the papers and so forth, but nevertheless, there is a lot to take into account. And on that point, I think we're at item 6.
Chairman, excuse me, I've only just managed to get in. It's Councillor Willis.
Oh, hello, Roz. Sorry, Councillor.
Yes, I've only just managed. It's been a nightmare. I'm sorry, I missed the election of vice chairman. So who's vice chairman, please?
Councillor Hughes.
I thought it might be. Thank you.
Okay, if we can, let's move on. Item 6, COVID-19 commissioning update, and I believe it is Gerald going to present that. Over to you, Gerald.
Yes. Thank you, Chair. Yeah.
You need me to share, Gerald? Share your presentation?
Yes, please. Yes, please. So thank you, Chair. Yeah. So this is a further update with regards to, particularly from a commissioning perspective, some of the challenges that our care providers are facing, and some of the support and actions we're taking to mitigate that. So a whistle-stop tour.
Sorry, can you just bear with me a minute?
Yeah, no, that's fine. And for clarification, I'm happy to take questions if Leo, you could perhaps highlight, or the chair, if you want me to stop at any point in the presentation.
I'll do that, Gerald.
Thank you.
Here we go. There we go. Can you see that now?
Yes, we can see that. Can you go to the next slide?
Bear with me. There you go.
Okay, so going over the various areas of support that we have in place, and this is a key in our prevention agenda. People will be aware of the wellness service that was introduced last winter successfully, and funding has been extended to this financial year. The service supports, I think it's a bit more than that now, but supports around 70-80 individuals, providing support for those clients that are socially isolated and lonely or waiting for care packages, and provides very much a halfway house support between the fantastic support that North Somerset Together and our voluntary sector have provided, and also in terms of our statutory access to services. So it is for individuals that perhaps are below that threshold. So it is consistent support. It is an experienced care provider that provides this service, and it has very much a flavour around tech support as well, offering access to CareLink, etc. Do you want to go to the next slide?
No. Chairman, can I ask a question, please?
Sorry, I was muted. Yes, Gerald, I think if we could.
I want a question.
Yes, I'll come to you in a moment, Councillor Harley. Gerald, can we just note that I've advised members that the questions will be responded to on a page-by-page basis. Councillor Harley.
Well, Chairman, it's really clarification, but a couple of points I just want to raise. One is the socially isolated and lonely. I mean, that's a very wide subject, and I don't know whether it's addressed anywhere else, but quite frankly, the socially isolated and lonely are causing a lot of concern, particularly those who are in a home, to people that I know. And the other one I want to pick up, I don't know what vulnerable informal carers means, but what I am concerned about are the carers, and I'm one of them, that are totally isolated in some ways, and that people do not go out to the places that they used to because they're shut down. What are we doing about those carers? Because they're taking the brunt.
Gerald?
Well, I mean, this service is part of a wide range of support that's offered. I referenced the lot of the work in local communities, Somerset Together and other voluntary sector groups. We also have, our carer support services and promotion of carer support. So there is a variety of options, but this is clearly a service that has responded to the COVID crisis and is offered for those that are particularly experiencing difficulty and are more vulnerable and require a level of support and response to that.
Sorry, go on, Councillor Harley.
Yeah, can I come back on that?
Yes.
That's the sort of response I would have expected, actually. But it's a much wider problem. It's a much wider issue. And when we come out of this, we've got to be prepared. And there are going to be some very fragile people that may not have been taken into this consideration. And if we have to go to Care Connect or anything like that, that takes about goodness knows how long to be assessed, etc., etc. And I'm talking about generalisation here, and I want to be confident that we are picking up these most vulnerable ones. I understand what you're saying, but that's the response I would have expected. But it's much deeper than that.
Councillor Harley, thank you very much for that. Can we come back to that in more detail later in the meeting when we discuss the work plan? Because I think that is something that will be helpful in terms of seeing what it is that we're proposing with the within the work plan that will further and help and assist our understanding of those issues, concerns and aspirations. Is that acceptable? Councillor Harley.
You're on mute, Councillor Harley.
Sorry, I don't mind when you come back to it, but it's a question I would like answered, please, and dealt with.
Gerald, would you like to comment further?
Yeah, I can comment further. I mean, as I said, the reference to the halfway house is that this does not require a referral from Care Connect. It has a variety of referral points. GPs could refer, as the next slide talks about. We are acted as a follow-up from hospital discharge from the initial response from Red Cross that provide an initial assurance check after 48 hours. If there's uncertainty or concerns that they have, they are now, it's taken a while to get there because of data protection issues, but they will now refer to the Wellbeing Service. So there are different routes into this, and North Somerset Together will refer in to the Wellbeing Service if they feel that they are supporting individuals that require a little bit more care supervision. So it's not linked to, well, it equally could be referred from Care Connect and SPA, but it's not exclusively has to come through the social care systems.
Thank you, Gerald. Thank you. Anne, sorry, I keep forgetting it's formal meeting. Councillor Harley, are you putting your hand up to ask another question?
No, I'm not. No, I won't.
Okay, Gerald, if you'd like to proceed.
Yeah, and I think you know, it is a broader point, and I'm not sure you'll come back to, but yes, we recognise that social isolation and mental health issues will have increased and will increase, and that will be an ongoing need that we will need to satisfy. There is more capacity for the wellbeing service. We still have more capacity that it can take more. So, but you know, hopefully we're moving towards the light at the end of the tunnel, and hopefully we can and reduce this. I have to say, there's a
before
little...
you go on.
Yeah.
May I ask, please, can the screen be shared fully? I've got a barrier down the side. I'm not actually getting the presentation. I'm getting everything else that's on the screen, and on an iPad, I'm not seeing it very well.
Does that help?
That's fine. Thank you. Let's proceed, Gerald. Thank you.
I think I'll move. Can you move to the next slide? So I also linked again to the wellbeing service, and as you know from that we've recently put in a commissioning plan for a tech partnership. We are, as part of that service, we are offering access to a range of tech equipment to support people that are isolated at the moment. And they provide a range of monitoring and quality assurance issues that supports individuals and links them with that assurance. Do you want to move on?
Yes, please, Gerald.
Critical in terms of the support to the hospitals is the Integrated Care Bureau. The ICBs were introduced before COVID, but very much have been the heart of how health and social care in the community have supported the mobilisation of ever faster hospital discharge arrangements. There's some excellent work that's done by the brokerage service and the arts service in supporting individuals following the initial hospital discharge pathways that have been created during COVID, which are supported by Sirona as our community support provider. I think Hayley and I are on regular, daily contact with on system calls, and I think it's reassuring for our community that those pathways have flowed much more safely and robustly over the COVID period. We have seen good hospital discharge flow from our care services, almost without disruption, despite some of the huge difficulties our care providers and our professional social work teams have had during the challenges of the last few months. It has been noticeable that we've had a lot less hospital discharge problems than our neighbours, Bristol and South Gloucestershire.
Chairman, can I ask a question? I've got my hand up.
I'm just checking on the conversation. Hugh, have there's a question that you've put in saying, forgive me, what's right to reside? Is it related to capacity? I'll come back to you, Councillor Harley.
Right.
Yeah, sure. If that, I just put it in the chat to see if I get a quick answer, but right to reside, I'm guessing in this context, that's definitely not related to immigration. What's right to reside? Is it related to capacity?
Right to reside is a new NHS term that replaces some of the previous hospital discharge language. So it is about choice and direction for hospital discharge.
Okay, brilliant.
Thank you. Councillor Harley?
Yes, Chairman. It's really clarification again. I am slightly concerned. I'm pleased that Gerald has said, there's an improvement in discharge. I unfortunately have not seen that. I feel that a discharge from hospital is worrying to me, for the very simple reason is that they don't check on who the carer is at home or anything like that. What they ask is, have you got anybody at home to look after you? So that person who is a carer is not included in any of those conversations. And I think that is a serious loophole.
Gerald, can you respond?
Yeah, well, I mean, obviously, what I was referring to was the impact of our commissioned social care services in terms of delaying hospital discharges. All our acutes in BNSG have been under incredible pressure. All sorts of issues throughout the period, particularly during the more recent waves around delayed discharges of a more general nature, but I'm speaking specifically about the impact of our social care providers contributing to any further delay. I would also add that clearly you have the Red Cross. We also support, and very effective in this area is the Home from Hospital service that does support people with the hospital discharge arrangements. But clearly the hospitals at certain points have been under incredible pressure to make as rapid discharge arrangements as possible, and I'm sure they would equally recognise that has brought challenges. I saw Hayley might want to come in at that point as well.
Yes, Hayley.
Yes, I was just going to say, Councillor Harley, in regards to failed discharges, we've seen very, very few throughout COVID, and Gerald and I do follow them up if there are any failed discharges. So I just want to give you reassurance that we do monitor the quality of people being discharged and how carers are being informed about those arrangements.
Can I just come back to you, Chairman? Can I just come back on that? Because it's clarification I want.
Yeah.
So what I'm hearing is that really and truly, most of this is to do with those patients that are under social care, not the wider circle who may not be under social care, the wider people that may not be under social care. There is no checkup on them. It's just the people who are in our social care that we are dealing with.
No, I think, Councillor Harley, I think that's where Gerald was talking about the community and voluntary sector and the Red Cross. They will work with people, won't they, Gerald, regardless of whether they're social care funded or not. And we do contribute to their funding as well.
Yeah, so I don't know whether it's on the slides or not. So the vast majority of people would be classified as pathway zero, i.e. they're discharged with no service. Pathway zero is supported by the Red Cross, who do that reassurance call after 48 hours, and unique to North Somerset would then identify those that perhaps need more support and refer into the wellbeing service. Where the rest of the hospital discharge arrangements would be pathways 1, 2 and 3. So that is reablement support or rehabilitation support from Sirona, the community provider, either in a person's home with Sirona community support for a number of days, and or a placement in Clevedon Hospital or one of our P2 or P3 beds in care homes, where again Sirona would offer a rehabilitation support during that period of rehabilitation. After that stage, after those pathways, that then becomes the responsibility of adult social care. So that has been the COVID pathways, and we're now in further discussions and inevitably about funding. Further discussions around what those pathways will look like post the COVID arrangements, and we await clarity around NHS COVID funding and what the implications on some of our services will be.
Thank you very much. Councillor Harley, do you want to come back on that again briefly? please?
Yeah, no, thank you, Chairman. No, I understand where they're coming in. Can I just say in answer to Hayley and Gerald that yes, I've experienced the phone call from the Red Cross, but quite frankly, and I'm not stupid, but I actually wondered why they'd rung up. So I'm wondering whether that sort of information is out in the general public, that they may get a phone call from the Red Cross or somebody else. So that's important to actually let people know so that they are not shocked by it.
Thank you, Councillor Harley. Councillor, can I just re-emphasise again? I am particularly drawn to and interested in your concerns with regard to this issue, and it's something that I would like to highlight again later in the meeting with respect to the working plan and so forth. And I'll be grateful for your input into that. I believe Leo's had his hand up patiently for some considerable time. Leo?
No, I haven't had my hand up. If I've got it up, it shouldn't be up, so ignore it.
I think that's a lingering
I
hand from Hayley.
have, Chairman.
All right.
Councillor Willis has.
Sorry, sorry, Councillor Willis. Please.
Councillor Willis has. Can I come in?
Yes, indeed.
Bless you. Thank you. I'll take the hand down in a minute. The hand's on the face. It's a nightmare, isn't it? I can only say about the Red Cross issue that I've only had positives from it from my neighbours that I have around me and some of my residents. I have a neighbour who was taken into hospital last week. I keep an eye on her bedroom curtains to know when she's up to make sure she's all right. And she wasn't well. Ambulance came and took her. Red Cross brought her back and made sure she was okay, brought her in. She is on her own, but because we're all, you know, not in each other's houses, it means neighbours can't go in and do whatever. And the Red Cross were absolutely amazing to her, she said. She isn't in any social care issue. She's 91 and lives on her own and does all her own gardening, so she hasn't got those issues. And then she had to go back in Friday for some tests, and the Red Cross supplied, it was a taxi to take her in, and then the Red Cross brought her back. I also have had godchildren who've been suffering with COVID from Boxing Day, and 2 of those have used Red Cross because the whole family were down. So for the western side of it, I can only say it's worked well with the Western Hospital issues. I don't know about the other trusts. Maybe that's where it's not working right. I don't know, Gerald. Maybe that's Hayley, whether some of that is not so easy.
Well, to be fair, I think NBT was the first to pilot the Red Cross service, and Western was the last, actually. So these services are more mature in the other hospitals, and Mike Riggle will be pleased to know that part of the problem was getting the data protection issues sorted, particularly for UBHW, who had a problem in that area. Fortunately now those pathways are up and are running, and we can mature the arrangements with the wellbeing service, who, you know, I do recognise that that initial call after 48 hours, you know, situations can deteriorate. So we're very keen that where there is a cohort that is possibly in that risk area, that we do follow that up after 8 days. And do a further check, but that is primarily only available in Western.
Thank you.
Okay.
Can we proceed?
Yeah. So we move on to vaccinations. So sorry. Yeah. I'll move on. I mean, obviously, I think we've shared these slides before. That does, the brokerage slide does reflect the 7-day service and some of the additional services that we've put in place with that, the additional NHS monies. So, sorry, I should go back. Sorry, can you just go back, Leo? Sorry. I think some of the innovative services from a commissioning perspective that we have been able to put in place is we are now offering a level of enhanced hospital discharge arrangement in the Clevedon Extra Care facility. We are also have additional block beds to support the Sirona service, and We are also commissioned some waking night staff and living carers, and living carers is a growth area, and I think one that we would want to see sustain and thrive. And that access to that service is within 24 hours, so it can respond in an emergency, and it's quite critical in terms of appropriate hospital discharge, but also prevention of hospital admission, and I think these are areas that will grow. Sorry, I will move it. Sorry, Leo, can you go back to vaccinations now? So, I mean, obviously the fantastic work within the primary care, the GP services to mobilise the vaccinations, and you have an update there, particularly around some of the early priorities in terms of care home staff. So 92% of care homes residents completed. The range, you know, the success as of 17th of February around the over 80s population. And, you know, all of our care home staff have been offered a vaccine. So, you know, it's really very high. It's very high offer. And, you know, 76% I think is referenced in terms of take up among frontline staff. That actually is higher than the national average. So it's all very encouraging. I think we would want to thank contract manager, Teresa Maguire, that's led on that, and I think has done a really fantastic job in getting the what was quite a challenging bureaucratic process to get the links out to the right people at the right time. And I think North Somerset was one of, you know, got mobilised very quickly. But that also, you know, more importantly, does reflect the huge efforts that our local GPs did to vaccinate quickly and early, and ensure that our care providers are as well protected as they are now, although we're not out of the woods yet. Thank you very much, Gerald.
Chairman, can I ask a question, please?
Yes, you can.
Sorry, I've got my hand up, but it's obviously.
I know. I was responding.
Oh, sorry. The connection is quite bad. It's just, Gerald, can we have some idea of how we're dealing with the BAME minority people, you know, because obviously nationwide there is a problem where some of them are not accepting vaccination. Do we have that problem in North Somerset?
I mean, I think it's been identified with engagement with our care providers that there are some community groups that there is a lesser inclination towards vaccination. We have fed that back to the primary care leaders on this. There has been workshops, there's been videos, there's literature being produced, and obviously instructions given and information in different languages, etc. We now record an awful lot of data on the capacity tracker that's referenced in the slide, and I think that is a growing area where our attention now will be to try and scoop up those groups where, you know, take up has been lower. But as I said, 76%, and that's worrying still that you've got 24% to go, but actually that is higher than expected at this stage, and clearly there's more attention going to be in that area.
Thank you very much, Gerald. Councillor Willis. You're on mute at the moment. Councillor Willis? Are you there? No? No, right. Councillor Hugh James.
Bro, just specifically on the black and minority ethnic point, Bristol Council doing amazing work. It would be good just to copy and paste what they're doing really for BAME people in our community, and I think specifically here we might have in Portishead it seems like the problem is general members of the public, but that's a different matter. But if we could do some work on Roma Gypsy traveller people here, I know that there's a lot of suspicion about vaccine within some of that community. So any sort of targeted outreach we could do for that specific sort of group and community would be really helpful.
Yeah,
really great work. My parents got vaccinated today. I was so happy.
Right.
Excuse me, Chairman. Can you hear me?
Yes, I can.
Councillor
now.
Willis, can you hear
Councillor
me?
Willis. I can now,
Oh,
yes.
I'm sorry, the phone went, it took me out of screen.
Right.
It won't bring my
Okay.
camera back. I'm sorry if I missed something, but could I speak before I went again?
Yes. Please
Thank
speak
you.
now. Speak
I
now.
was trying to come in on the BAME issue. I had a conversation last night with the Bangladeshi Association yesterday afternoon to make sure that they didn't need extra helper capacity and they were getting the message out okay. And working with the council and CCG and the local GP, Peer Health, etc. They opened up the local mosque in Weston-super-Mare and for vaccinations. They had managed to do 100 vaccinations so far and are there ready to carry on, and we're getting the message out. I did say to come back to me if we needed any extra help to get to them, but at the moment the BAME were getting there with the forum. So I wanted to update that because it was only yesterday I had the conversation.
That's very helpful, Councillor Willis. Thank you very much. Can we go to Hayley Verico and then Richard Tucker?
Yes, thank you, Chair. Councillor James, I just wanted to give you some reassurance on the Black and ethnic minority groups. We did prioritise all of our frontline staff who were identified as being vulnerable, and the take-up in the council of our frontline officers is well over 95%, so that's really encouraging. And as Gerald said, we have put a lot of information on the website. It's also gone out from the care provider cell, really encouraging take-up of the vaccine. But what I would say as well is the government are not prioritising Black and ethnic minority groups. And we do need to be led by the government because they are the ones that have set the priority cohorts. But I absolutely take on board the need to do more in that space. So if there's anything that we can learn from Bristol, we'll have a look and see what we can do.
Thank you very much, Hayley. Does anyone want to respond to that? Can you please wait for me to respond? Thank you. Does anyone want to question what Hayley's just highlighted? No, thank you very much. Councillor Tucker.
Thank you very much, Chairman, and thanks very much for the slides on that, Gerald. There's been a lot of coverage lately about some care home staff obviously refusing vaccination. Obviously, that's a national issue, some of them sort of objectors, etc. But I've just wondered what, there's been obviously discussion about making it a condition of employment in the future. Obviously, we can't sort of get involved in that at this stage, I guess, but I just wondered what leverage we had locally to be able to kind of persuade them, cajole them a little bit, because obviously it's in the patient's interest at the end of the day, isn't it?
So yes, I mean, so there's obviously a lot of debate about the contractual obligations, which I think many care providers will look at new employment conditions, but not, there are human rights issues around existing employees. So clearly it's very much around persuasion, and there is an awful lot of information that has been cascaded to care providers. We are monitoring take up, so they are recording vaccinations, so we will know the cohorts of non-vaccinated staff in care homes and obviously look to target those groups. As I say, there are, it has tended to be younger workers that perhaps are thinking of future family requirements, and the initial uncertainty in that area that has been now clarified. So we're working closely on there. Our care providers have picked up that there is a cohort within the Eastern European community that sort of has some reservations and we've looked at translations there. We are working very closely with Bristol and South Gloucestershire, and any good material we make sure that all our care providers had. I know we sent something out that was one of the larger national providers that produced a learning difficulty guide to vaccinations that was, a video that was really excellent that we shared quite widely. And also the provider associations are also, in this space, encouraging their providers to move forward on this. It clearly, as we now move beyond the broader care sector and we're up to the 76% mark, we will start to look at targeting groups and ensuring that all our care provision services are as safe as they possibly can be.
Thank you very much, Gerald. Richard, was that helpful?
Very good, thank you. It's just to sort of comment on that. A lot of it is kind of a lot of rubbish they read on social media, I think, sort of feeds this sort of behaviour. So I don't know if we can sort of where you find this stuff and combat it, really. But
I think there are some other factors that Hayley Verico can now tell us about. Hayley.
Okay, Chair, if you would allow me to, firstly, I want to give thanks to Gerald and his staff, because we have absolutely excelled in terms of the vaccination rollout. And Gerald did dedicate a member of his staff literally to do this work. And being no doubt that adult social care is still under very significant pressure. And so for Gerald to recognise that we really needed to focus the effort, I think, is a massive achievement. And so I would like the committee to thank Gerald for that effort, because that's why we've been so successful. What I would say that we did influence, and again, I'm going to sing the praises of adult social care and commissioning, because I really did push for informal carers to be prioritised locally for the vaccination, and we were very influential in that area, and so we really pushed that agenda forward. In terms, Councillor Tucker, we have been using Facebook to put across very positive messages around vaccine hesitancy, so we have been working really hard in that space as well.
Thank you very much, Hayley. I think that, Hayley, you also provided some information recently, for example, and I particularly noted, for example, that there was hesitancy amongst some of the care home staff, particularly those under 25, if they were planning to start a family.
That's
and
correct.
That had sort of generated some reluctance from their perspective and so forth. And I didn't know. That's really helpful. Can I also echo on behalf of the panel, your support and so forth for the efforts that Gerald and his team the additional efforts that Gerald and his team have put into it. I think that we all, I'm very glad that we know about it, and I'm very glad that we can applaud it. But Councillor Harley, sorry to have left you out at this point, but as you'll appreciate, I had to get some other voices through. Okay, we're welcome to speak.
Chairman, can I just say my screen has gone into lockdown? Probably it's had enough, but never mind. But no, I don't want to say anything on this, thank you. But right. Just to say well done, from Hayley's comments. Thank
you, Councillor. Your hand was up, but now it's down. But thank you very much. Okay, please, Gerald, let's move on.
Let's move on to the other big ticket item that we've been involved in over the COVID period, which fortunately is a lot calmer now, but PPE has had its moments, as you can appreciate, over the length of the period of time, and the council has operated as a provider of last resort, and at some stages early on, when we managed to get some PPE from wherever, provider of first resorts. But fortunately, that situation is much more stabilised, and in some ways, a lot of the work with our health partners has been around the appropriate use of PPE and the learning and training around that, and ensuring in a contract compliance context that the PPE was being used appropriately and that homes were accessing specialist training on use of PPE. Inevitably, that hasn't meant that there hasn't been a lot of outbreaks in our care homes, and this wave has been particularly difficult for the providers. We most weeks in recent times we've had possibly anything up to 30 of our 100 homes experiencing some level of outbreak. I'm pleased to say that the number of outbreaks are dramatically reducing now, as obviously, hopefully, the impact of vaccinations is starting to take home. But we still have the odd one, and clearly all our providers, and ourselves, we can't take anything for granted. We're not out of the woods yet, and there are still real risks that PPE needs to be used appropriately. And it is a challenge. This wave has proved particularly difficult, and when outbreaks have occurred, some have swept through homes with most unfortunate outcomes. But as I say, I think it has been an excellent effort. And the next slide that you have there just shows the amount of PPE that we have provided. So that's emergency response. So if you think about what the providers have provided for themselves or have had allocated by other sources from the NHS, you can appreciate just how much equipment is used to support our care providers.
Chairman, can I ask a question, please?
Can I get to it, please?
Yeah.
Councillor Harley.
Yes, Chairman. One of the questions again is clarification, and I'm sure there's bits duplication in the further report. But one of the concerns I have is the fact that all the hospitals, all the care homes had no visitors at all. So anybody going into these places were staff. And so any infections that were brought in were by staff. Now, I've got my own opinions on this, and my opinion is, and I don't know how it works, and I understand all the things that you're putting here to help, but one of the main things is that years ago, people who were looking after patients and whatever were not allowed to come into the hospital in their uniforms. From outside, they had to have changing facilities so that they actually put their uniforms on in the hospital or the care homes. I'm just wondering, Chairman, whether that is something of the future that we need to look at, because we can have all the PPEs, we can have everything like that. And as we've seen, without visitors in the hospitals, without visitors in the care homes, the infections have still gone through pretty quickly. There's one care home actually in Cheddar that's done exceptionally well, and they've taken another approach. But I just feel that that's where we need to look at.
Thank you very much, Councillor Harley. Can I go to Gerald for response and then to Hayley Berrico?
Yeah, so I mean, I think I would point out that, you know, I don't think there's any blame attached in terms of outbreaks in most cases. You know, we provide a multi-agency response to an outbreak, which is led by public health, but involves CCG, Sirona, and ourselves. We would work with the provider around assessing how the outbreak occurred and what corrective actions could be taken. And as I say, most cases, I would say that the care provider has acted incredibly diligently. There is a later slide that talks about the care home action plan and funding that was associated with that. And again, that was a multi-agency response to support the care home sector with prevention of outbreaks. And that did involve funding the conversions of rooms so that staff did not wear the same uniform. So they changed before they accessed the building. Some of our care providers have responded incredibly in terms of intuitively responding to preventing outbreaks. Inevitably, there will be some that perhaps could have done more, but you know, I think the challenge that they faced, and as we know, hospitals have not been they've had their own problems, and they have, obviously skilled IPC provision. So I think we should not draw any negative conclusions from the number of outbreaks. Just recognise just what a challenge trying to achieve complete protection in an environment where you have so many vulnerable people.
Thank you, Chair. Thank you, Chairman. May I just state here quite clearly, I'm not making any blame at all. I'm making suggestions that maybe we look at something like this in the future.
I'm happy to discuss that further, Councillor Harley. Can I just suggest at this point, can I go to Councillor Haverson, Hayley, because I would like to, and then back to you.
That's fine, Chair.
Sorry, is someone...
Okay, thank you. Yes, I was just wondering what our policy is with reference to FFP2 and 3 masks versus medical masks, because I noticed that we're just recommending FFP2 masks for aerosol generating procedures. But if I understand it correctly, speaking and talking and breathing creates aerosols as well. And it's the amount of airspace where people are together in close airspaces for a prolonged period of time. And I feel very strongly that there's still not enough awareness of the risks of aerosol spreading, much more about hand washing. And in my opinion, humble opinion, we need to take a lot more notice of aerosol spreading and use FFP2 masks a lot more than they have been used so far. Thank you.
Right, Gerald, do you address that? Sorry, can I, if you could address that, albeit somewhat briefly, I do want to go to Hayley at some point.
Yeah, okay. I'll address that one. The FP masks are not on there because FP masks in aerosol circumstances would be provided directly by the NHS, and so they would come from another source, not the council, for the specialist equipment. And we have to appreciate that there has been a lot of learning at a national level around this, and the guidance has changed hundreds of times in terms of the position with regards to the appropriate PPE equipment. And we do have Rob has learned an awful lot about it. I'm sure he would get his he would do well in an exam on PPE guidance now. So we have had to keep up to date with that. But you're right, that specialist equipment, and there have been issues, and the NHS has had to pick that up around appropriate guidance to the care sector about the more specialist aerosol usage. But it's not an omission, it's the fact that it's sourced from a different source to the council.
Thank you very much, Gerald. Karen, do you want to respond to that? Right. Hayley?
Sorry, no, I just forgot to lower my hand. Sorry.
Okay. Thank you. Hayley?
Yes, Chair. I just want to mention, personally, I don't think that the efforts of adult social care have been nationally recognised throughout COVID, which I think is very disappointing. And Gerald is being very modest because Gerald's team did deliver PPE out of hours. They delivered it at the weekend as well in many thousands of units when they really needed to. And I don't want us to forget, in terms of the care staff who work in residential settings and domiciliary care, they did put themselves at risk every day going to work, and they were left very upset by people who became significantly unwell and unfortunately died. And so I think this is a reason to celebrate, because those numbers that you've got up on the screen, I'm sure you'd all appreciate, are very significant, and it did take a lot of effort.
Thank you very much, Hayley. I'd echo that. I think that adult social care, and certainly a great deal of the work that Gerald his team has carried out, in addition to those in the wider area, I think it's an issue that certainly attracts more brickbats than it does bouquets. And there are moments, there will be a moment in time when we can look back and say how well they did, how well they did. Bear in mind, when this pandemic began, there was no book that said this is how you manage a pandemic. We had to get down into the grassroots and deal with it. Anyway, before I go off on one, back to you, Gerald.
Yeah, thank you for that. I suppose I would just add to that in the context of, I think Hayley will recall, we were, Councillor Bell may recall, we were actually sort of seen as being a little awkward because we were one of the first councils that actually appealed for PPE from the community, and we did have a fantastic response. Because we recognised that there was a period of time where PPE was a challenge for the care sector, and we were able to get an awful lot of PPE and distribute it in those early days to ensure that there were not the awful scenarios in North Somerset.
Thank you, Gerald. Are you carrying? Do you want to proceed to the next?
Yeah, I'll try. Next slide is just an update around, as I think I've referenced the capacity tracker. The capacity tracker was not used in North Somerset, but because it was seen as a sort of market for which particularly we were not necessarily keen to expose our care homes to a broader market, so that there were a lot of out-of-county placements. However, during the COVID process, the capacity tracker was repurposed very effectively to record lots of information about PPE, sickness, COVID incidents, and sickness in domiciliary care. So I'm pleased to say that we changed our position. We U-turned very quickly on the repurposing, and we have one of the highest responses in terms of our care providers in terms of usage of that, which makes this information all the more useful. What you've got there is recognising that in this wave in recent weeks, because obviously the prioritisation has gone to care homes for vaccinations, that's changed now. Domiciliary care is up there now, but recognising that domiciliary care staff were potentially in this wave vulnerable and hence on to their clients. So there has been a growth in cases, which fortunately are now tapering away in the domiciliary care sector. Clearly, in terms of supporting hospital discharge, it's important that domiciliary care resources are there. I'm pleased to say that domiciliary care resources throughout the COVID period have been fairly stable. During the early stages, we actually saw a big hike in recruitment. And some of members that have been around a little bit longer will recall that we've had unmet need at times, and the shortage of dom care, that's all reduced dramatically during COVID. So we are in a very healthy state, and not all authorities have experienced the same pressure. Sadly, South Gloucestershire have had an awful lot of difficulties with their dom care provision and recruitment of dom care staff. And it's a similar community to North Somerset, so it's a little odd that our experience has been quite so different.
Thank you, Gerald.
So, moving on.
No, one moment, please. Hayley, your hand is up. Do you want to add to something that Gerald has said?
Apologies, Chair, that's a residual.
Okay, thank you. Carry on, Gerald.
Okay, I'll try and quicken up now. So the action plan, which the government mandated, which was to articulate what our care home support plans were. That, as I said, is multi-agency, and covered a lot of ground. That you've got details there, but unless there's questions, I won't go into any more detail.
Thank you very much, Gerald. Right. Any other points that anyone would want to raise?
Chairman, can I raise one? Not on this. Can I just ask whether Gerald's finished his presentation? Because in actual fact, unfortunately, I was called away, so I missed some of it. But I didn't know whether I'd missed the one about all deaths with place of death equals care home.
I've not got there yet.
Oh, right. Well, all right, Gerald, I'll wait until you get there then.
Okay.
Thank you very much, Councillor Harley. Okay, so please carry on, Gerald.
Yeah. So I won't do this justice, because obviously this is, particularly on the community engagement work that Richard Blowes has led on. But clearly, adult social care, particularly commissioning, very closely involved in how the overlap and the interface and referral points for those services. So you do have some details around North Somerset Together there, and just the sheer number that has clearly helped adult social care get through this crisis. And obviously the important work that our commission services, we referenced, and perhaps if you are looking at hospital discharge, the fantastic work that the Home from Hospital service, which we commission as part of the Alliance floating support. So from Alliance, they provide some really good information about those services. So that could be a point of reference if you want to look at hospital discharge. But I won't say any more on that unless there are questions.
You're on mute, Chair.
Any questions? Any questions? Thank you. Let's proceed, Gerald. Thank you.
So then, just to give you the, the sad reference in terms of the monitoring of deaths in care homes, and you can see the waves that we have experienced there, and you have, for comparison, you have Bristol and South Gloucestershire. I'm pleased to say that, again, if we took there is a bit of a lag on this data, but if you took that data forward, those numbers are dropping dramatically.
Thank you.
Yeah, I'd like to ask a question on that one, Chairman.
Yeah.
Gerald, you can only sorry. Sorry,
in future, could you just try and get your hand up on the register?
I'm trying desperately, but it's very difficult.
Yes, it's just that I do need to try and
here you are.
Obtain a list of who is speaking, but please go ahead.
Well, it's a hand up now, just as a matter of interest. It's a hand up.
You've taken it down.
No, it's not.
Well,
it was up, but you've taken it down, I'm afraid.
It's what? Is it up now?
No, but please go ahead and ask,
ask
your question. We'll assume it is.
Yeah, okay. Well, that's why I've had to sort of, unfortunately, just speak. Right, Gerald, I know that we can only deal with figures that we've got, but I'm probably one of those people who actually feel that a lot of people have been certified as dying of COVID and probably haven't. And I suspect that's because there's so many people that have died, they cannot get a proper, report on what they actually died of. And so it could be that the figures of people who have died of actual COVID are much lower than they are. That's what, and I think it's coming out publicly now, because some of them have questioned about their parents dying of COVID, and they haven't. It's just either old age or gone to sleep, not woken up.
Yes, I think I can answer that question, because in the context here is I've used the data for all deaths in care home settings. It would be more useful if we showed the longevity of the previous year. I can assure you that those spikes are significantly higher, and the reason we've used that rather than, there is separate data for COVID related deaths in care homes, but that data is quite unreliable for all the reasons that you've said about the attribute of what the reason is for the death. So I think it is probably better to look at all deaths in care homes and look at the impact pre and post COVID. Unfortunately, you've got the data which shows you the graph, that the impact of the waves here rather than and the comparison. But certainly there has been a significant increase in deaths in care homes.
Thank you, Gerald. Councillor Willis. Hello, Ros.
Thank you, Chairman. Unrelated to this, but I think, can you hear me?
Yes.
Can you hear me?
Yes.
Yeah.
Thank you. Unrelated to all of this, can you hear me now?
Yes.
Hello.
Yes. Right.
The IT issues are absolutely appalling this morning.
Right.
I can't hear people. I've got no camera.
Sorry.
Half of it's not working. I think IT need to come in onto this meeting.
Right. Councillor Willis.
I can't hear anyone now, so I don't know where I am. So.
Right. Right. Hugh, can you come in whilst we try and deal with Councillor
Can you hear me now, sir?
We can still hear you.
We can still hear you.
Thank you. I think IT need to come in on this meeting. I'm losing Gerald. I'm losing you. It's not just my signal here. Part of my screen doesn't work. My camera stopped working. The hand didn't work. I was losing you just now. I think IT need to come in onto this meeting to try and sort it out, because I am losing the will to live sat here, and I may disappear altogether because that's what's happening to my contact. I'm sorry.
Can I just ask, is anyone else sharing the same problems and so forth that Councillor Willis is?
Yes, I am. That's why you don't see my hand and why it's gone off screen.
Can I say, Councillor Harley, we do get you. It's just that sometimes your hand, you're not asking for me to say yes, speak. Sometimes you press your hand and immediately pose your question. That's it. Otherwise, may I finish? I can hear you, we can see you, and there do not appear to be any major problems.
Well, let me tell you, Chairman, I'm getting major problems here because I can't hear you. It comes back in a drone, and it's almost as if it's coming back 2 minutes after I said. That's why, because I'm not rude to jump in and speak. What I'm concerned about is then you move on and we have to go back. So really and truly, I do agree with Councillor Willis. It is not acceptable.
Right. Then can I suggest, Leo?
Yes, Chairman.
Can you please phone Councillor? Can you arrange? I don't know if there is a means by which IT can contact Councillor Harley and Councillor Willis to speak with them regarding their current concerns and so forth. I am not minded at this point to close this meeting.
Oh no, don't want it closed.
Right. So
no, Chairman, I don't wish for you to close it. I'm just saying that we do have a. Right. There are some of us are having a problem. You're all freezing, and if I disappear, it's because of that. And I do think IT need to know.
On that basis, Leo, is that?
I'd just say that we do have some monitoring. There is some monitoring going on at the moment. We will do what we can in the background. It is very difficult to resolve these issues in live time, but we will do what we can.
Right. Thank you very much for that. In the meantime, I do wish to progress, and I'm happy afterwards to speak directly to Councillor Willis and Councillor Harley to see what other additional steps we can take to assist. So on that basis, can I move to Councillor James?
Yes, it's very useful to go as close as your router as possible, and the library service offer a wonderful IT help, so do take advantage of that. I just wanted to relate this to a couple of months ago. Gerald shared an anonymised case study. I won't go through it all, but just relating to this, it was talking about the psychology of this event, of the pandemic, and how care home staff, feel the guilt for transmitting disease, the real anxiety around this pandemic, and the pressure that care home staff feel not being able to leave work because they know that if they are absent or if they don't work their overtime, they feel that that their care, what's the word? Patient isn't the correct word, but I can't remember the correct term. Clients will suffer. So, this sort of highlights just the sheer amount of death, unfortunately, that care homes have had to put up with an experience, and just to hopefully we'll be able to recognise the bravery and commitment, especially in terms of giving a proper wage to those that a real living wage to those that work in care and dom care. I just wanted to feed that back through this as an appropriate point.
Thank you very much, Councillor James. Gerald, is there anything you want to comment on with respect to that point?
I guess I just want to echo it from a personal perspective, but equally, professional as head of commissioning, and I'm sure Hayley would want to endorse as well. We are aware of some absolutely fantastic acts of generosity and outstanding care in some really, really awful environments. And I think that, we as professionals and as councillors yourselves would want to recognise that, and hopefully that society will also recognise and value that going forward.
Thank you. Do excuse me, everyone. There was someone who had their hand up before I went to the Vice Chair. Whoever it was, was it you, Jill, Councillor
Yes,
Booth?
it was, but I didn't want to take up any more time on the subject in hand regarding Councillor Harley and Councillor Willis, because I was going to say exactly the same. I was going to say that I'll phone them up after this, because when they both want to speak, it may be more beneficial. When you've got this share screen, it's taking off so many. I can see, probably many other councillors can see, that Councillor Harley's hand is up, but maybe you can't, because it's very, very difficult to see councillors and hands up, whose hands, with the screen. I was going to give them a quick call to say try the chat facility, but if you're going to do it, then that's fine, Mark. And that was all I was going to say. And it appears to be it's just the two of them, so they'll probably kick me for that, but that's what it appears to be. Yeah.
Thank you for that. Right, Gerald.
Leo, I think there's one final slide, if I remember. Yep. And I think this is an important slide, because what I would want to focus on is the occupancy figures. These are the care home occupancy figures from the from the capacity tracker. So this is self-declared by the care homes. And the point I would want to make is that, at 83% and 80% in South Gloucestershire, who have had some higher outbreak and which have led to mortality and therefore higher occupancy, those numbers are a real challenge for the ongoing financial viability of some of our providers. So sadly, one aspect of this is we are on watch with regards to what impact that will have on the providers. As a council, we have distributed best part of £10 million of financial aid to the providers, either from ourselves or from the government in passported resources, but recognising that this is an incredible challenge if you as a provider are normally operating at 95, 97% and you're now operating at 83%. So having come through the awful experiences of COVID, the impact on their occupancy and the impact on people's propensity and reliability of going to a care home will be a COVID legacy that we will need to support where we can, where finances permit, providers that are experiencing difficulties. But equally, again, it's a national issue that will need to be addressed as to what is the future models for care provision.
Thank you very much, Gerald. That was what came across then, and the responses from members was no surprise whatsoever. It is an extraordinarily important issue. I think it's of huge concern to all of us. And I would just like to, on behalf of the panel, thank you for your presentation and your team's contribution towards this extraordinary place that we're living in at the moment. Thank you very much.
Thank you.
Any final comments the members would like to make before we move to item 7, which is Care Act easements?
Okay,
No?
Chair. Oh.
Go ahead, Hayley.
Chair, would you like me to introduce this item before Rick comes in?
That's absolutely fine. Thank you. Please proceed.
Okay, so I thought it'd be useful today to bring a presentation to you on Care Act easements. It's something that the government introduced early in 2020 as a response to COVID. And fortunately, and due to the efforts of all staff across adult social care and commissioning, we didn't have to enact Care Act easements. But all the same, I thought that you should be cited on what it actually means for the council, because COVID will be with us for a very long time. And so the legacy for adult social care will continue. So I'm going to introduce Rick, who's our principal social worker. And Rick, really, I refer to him as the monkey on my shoulder, because he's here really to ensure that we meet our statutory functions. And he does pull me up if he feels that we're not meeting those statutory duties and providing a really good quality of care to our residents. So I'll hand over to Rick. Have you got Rick's presentation, Leo?
I have. You need me to run it? That's fine.
Yes, please.
Yeah.
Thank you, Hayley. And hello, everybody. It's the first time I've been to this type of meeting, so it's a new experience for me. Very interested to have heard Gerald's report on contracts and commissioning and the response to COVID, because that is very much related to the Care Act easement that I'm going to talk you through right now. So Leo, if I could have the first slide, please. So as Hayley mentioned, the Coronavirus Act came into force early in the first pandemic in 2020, and within that piece of legislation, powers were included which would allow the local authorities to enact easements in relation to the Care Act 2014, but it would be the council's decision as to whether they need to enact those easements or not. I've included a link there to the guidance itself, but I think if we move on to the next slide, please, Leo. The easements to which the guidance relates and the legislation relates are included here. So they include limiting the extent to which local authorities carry out detailed assessments of need in line with the Care Act. They allow local authorities not to undertake full financial assessment. They allow local authorities not to undertake full reviews of care and support plans, and it also allows the councils to limit the extent to which they meet eligible care and support needs. If implemented, and it's important to note that we have not taken a decision to implement any of these easements, but if implemented, the legal duties in these areas become powers rather than duties. So it doesn't mean that you immediately stop doing this. It means that you can take a decision to meet them as far as possible, and you would continue to meet those pre-amended duties as far as possible. The one legal duty in respect to these areas that would remain is that we would need to continue adhering to the European Convention of Human Rights, and none of the decisions that we take in relation to how we meet people's care and support needs and how we assess them would be allowed to breach anyone's human rights. Can I have the next slide, please? No one has any questions?
Please proceed.
So in terms of making...
Sorry, you need me to go back a slide?
I think we've moved on to two slides. Yes, please. Thank you. In relation to the decision to enact the easements, obviously this has incredibly serious implications for people that use adult care services and for their carers, and there is a very fine ethical balance to be walked in terms of doing that and undertaking that decision. So the Department of Health and Social Care implemented an ethical framework which would enable the local authority and individual practitioners and professionals to guide them. And I've included some of the key themes that are included in that ethical framework in relation to respect, reasonableness, minimising harm, inclusiveness, accountability. You can see them all there. I guess these are not concepts that are alien to social work and social care practice, that they already run through what we do, but balancing the need to work flexibly to meet the needs associated with the pandemic, along with ensuring that people's individual human rights are respected and they have choice and control over how their care and supports needs are met, is often a very, very difficult balance. I think someone might have their hand up, Chair.
Sorry, thank you for that, Richard. Councillor Tucker.
Thank you, Chair. Thank you very much, Richard. I think I read in the papers last night when I was going through it that there's a lot of sort of local variation in terms of the interpretation as to how to actually apply the new guidance. Is that pretty much the case or the situation that you're experiencing locally? I mean, particularly in relation to our sort of local neighbours, the three other unitary authorities and a roundabout. But that seemed to be a bit of a theme that came over in the papers in terms of how it was actually applied and interpreted.
Yes, absolutely. I'll come on to it a little bit later in the presentation when we talk about a review that was undertaken by the Department of Health and Social Care and ADAS. Yes, it has been interpreted quite broadly and applied quite differently. And I think it's fair to say that the local authorities that did enact the easements in the first wave of the pandemic were quite heavily criticised for doing so. But when you dig down into their reasons for doing it, some of the decisions that they took were quite similar to those that didn't formally enact the easements and were saying that they were working flexibly. So I think that is absolutely right. There is a matter of interpretation of the legislation and the guidance in relation to these easements.
Thank you very much.
Thank you.
Any response? Any follow up on that, Richard, or is that helpful? Right. Okay. I noticed that Councillor James.
Thank you, Chair. Thank you, Richard.
I noticed that Councillor James has put up his hand.
Yeah. Sorry, Chair. Just wondering about the in terms of the framework for inclusivity, etc. What sort of data do you go by in terms of assessing the impact on, I'm guessing, mostly disabled people and vulnerable people? How would you do that? Do you consult those groups, or is it mostly assessments made about those groups?
I mean, I think when we're talking about the ethical framework, this was a range of, I guess, themes and values that we need to take account of when we are taking difficult decisions in relation to the Care Act. So we haven't been consulting necessarily directly with service user groups, and that is an area that perhaps we should think about going forward. The work we've undertaken in terms of raising the profile of the ethical framework has been within our own workforce to make sure that they are documenting and applying these principles and recording them on our systems when they are having to take difficult decisions. We referred to them, I'll talk about it a bit later, but we set up a professional decision-making forum so staff have a place to access the senior leadership team, so all of the service leaders, so we can take steps to mitigate the need to, where we're in danger of not meeting our statutory duties, we can take that to senior leadership and hopefully take steps to mitigate that and make sure that we do that without having to enact the easements. And within that forum, we would refer to the ethical framework and make sure that these principles are being considered. And we've also, in relation to discharge, to assess that Gerald touched upon in terms of hospital discharge, because the NHS now has a significant role in the early stages of people's social care needs following discharge from hospital. We've been trying to promote the ethical framework and the use of that with partners in BNSSG and Sorona.
Thank you very much, Richard. Any questions? Hayley, I think you want to add to that?
Yes, I was just going to add, Chair, that to give members reassurance, throughout COVID, we have been closely monitoring compliments and complaints so that we can identify themes. And also we have continued, despite the pressures, to audit casework to ensure that we are meeting our principles and values.
Thank you. Can we please proceed, Richard?
Yeah. So in terms of the decision to operate under the easements, there are only very specific circumstances that would allow us to do that. And the two main things that we need to consider are workforce and whether that workforce is significantly depleted as a direct result of COVID-19, or demand issues, so whether there has been a surge in demand in relation to COVID. And it's worth noting that this piece of legislation was brought in very quickly at the start of the pandemic, and no one knew what the impact was going to be on adult social care, but people you understandably suspected that there would be a huge increase on demand and a significantly depleted workforce. Fortunately, we didn't see necessarily the extent that was anticipated early on, and haven't had the need to do that, but we have had to enact various flexibilities, which I'll talk about, I think, in the next slide.
Thank you very much.
Chairman.
Harley.
Yeah, Chairman, can I just have just ask one quick question? And it's about staff. I'm just wondering, because we are so reliant on staff coming from overseas, whether we have noticed any drop following Brexit.
Richard, would you like to respond to that?
Gerald may be in a better position to respond to it, but my understanding is that in North Somerset we are less reliant on workforce from the EU than many other areas, particularly places like London, and I'm not sure it has had a significant impact on the workforce. As Gerald mentioned before, the adult social care workforce at the moment is in quite a strong position, but I might just invite Gerald to come in on that.
Gerald?
Yeah, thank you, Richard. Yes, I don't think we have seen an appreciable impact, partly because obviously we were promoting for a number of months the government's opt-in options with regards to existing European-based workforce. And as Richard said, we are slightly less dependent on EU workforce, but it is something. It's another part of the challenge, and clearly the fact that the financial threshold for future exemptions certainly doesn't represent anywhere near a care worker rate that is likely to be paid outside of management. We will continue to have to monitor that situation because it could have a longer term impact.
Great, thank you. Is that helpful, Anne? Sorry, Councillor Harley. I'll assume it is. Right, let's proceed.
Thank you, Chair. So this slide shows the various stages that local authorities can be at in relation to the easements. You can see that the first two stages are stages which mean that we are not yet operating under the easements and we have legal duties to continue to adhere to the Care Act. And stages 3 and 4 are the stages we would go under when we decide to operate under those easements. North Somerset Council has interpreted the guidance and legislation from the start and considered itself to be at stage 2, which means that while we continue to meet all of our pre-amendment Care Act duties, we are working as flexibly as possible.
Richard, can I interrupt a moment? Can I ask all members to mute, please? There seems to be something happening in the background of someone's microphone. So please, can we have everyone muted, please? Sorry, Richard, please carry on.
Thank you. as I was saying, we are working under stage 2 in terms of this decision-making framework that came from the Department of Health and Social Care. That means that we are having to prioritise certain things, but we are continuing to meet our statutory duties. And most local authorities are well used to applying some level of flexibilities to meet crises in the provider market or within their own workforce. So I think the crucial element to take from this is that we are working under the Pre-Amendment Care Act, but we have had to be flexible. We have had to be much more proportionate in the way in which we undertake Care Act assessments and reviews. We do that remotely in order to ensure the safety of our workforce and the people that we support. Home visits still go on when that is absolutely essential, but the vast majority of our work is done remotely. We have seen closures of some day centres and day services that are unable to adhere to social distancing regulations. It's debatable whether that fits within the easement guidance, because that doesn't directly relate to workforce or demand. It's to do with the social distancing guidance that came out. But again, there's been various interpretations of what these things that local authorities are doing actually mean. But it's also important to say that we are consistently reviewing our situation under the easements, and I'll go on the next slide to talk a little bit more about that.
Sorry, Richard, can Councillor Willis would like to pose a question.
Thank you, Chairman. I don't know if you can see me, but I don't know what's going on now.
I can see you.
You can see me, but I can't see myself, so I've no idea what's going on.
Please,
Nightmare. Under the DOLS, deprivation of liberty, under these easements. So I'm just wondering, under that situation, if we have someone at home who is going through the safeguarding bit and the DOLS, you know, if someone's got LPA, I know the courts, you know, it's difficult to get the court hearings, and if we're in dire straits, I'm just wondering where that is on that, because, you know, it's an emergency crisis situation, but I know Gerald has problems with getting the legal side, and then if you've got an advocate, an independent advocate for the person, and the courts aren't setting the dates. So a little bit of information on that, if possible.
Who amongst officers would like to respond to Councillor Willis's?
I'm very happy to respond to that.
Thank you, Richard.
I think I was in relation to DOLS and the Mental Capacity Act, which contains all of the statute in relation to deprivation of liberty safeguards. There has been no changes as a result of the Care Act easement. So in relation to the Mental Capacity Act and DOLS, there is still the same statutory duties applying that always applied pre-COVID-19. I think I take your point that there is a backlog in the Court of Protection in terms of hearing some of the community deprivations of liberty. They are not something that the local authority decides upon, but we have a significant piece of work in taking that to court sometimes alongside advocates, as you say. And I think there is a significant delay sometimes, and that can put people in a dubious legal position while they're awaiting that hearing to happen. There are measures of having things go through the court more urgently, and you can seek urgent authorisations from the Court of Protection, and I've known that to happen where it can happen within a matter of days. But our definition of what is urgent is sometimes very different to the Court of Protection, where there may be a significant backlog.
I hope that was of help.
Could I have a supplementary just to that for some clarity, Chairman?
Yes, indeed.
So the concern is, you know, for us as a council, you know, with those DOLS that are emergency, and we know we've got people at, you know, could be at home within, you know, great extreme, being in their own home alone, and things like Alzheimer's and dementia and things like that. Is there any capacity legally that the council can be not covered but more secure? Because my concern is that as a council, to protect the council and to protect social services and health, etc., that we need that protection, because if something goes wrong and you have someone alone at home and we know there's a problem and nothing's happening with dolls, they'll come back on us. Someone's going to come back on us as a council, social services, and say, well, what did you do? Those are my concerns about what can we do as a committee to try and make it more secure. Do I make myself sense? Does that make sense?
Yes, particularly the last bit. What we can do as a committee is of particular interest. Richard, I don't know if you want to address that specific point from Councillor Willis at that point, or whether I think it is a point in fact made more clearly to this committee, and I'd like to pick up on that later. Please proceed, Richard.
Thank you. So in relation to the duties that aren't impacted by the easements, we still have duties to promote well-being. We have duties in relation to safeguarding, and as we've just discussed, we still have duties in relation to the MCA and deprivation of liberty safeguards. We continue to need to work alongside the preventative agenda and provide information and advice and advocacy, and consider duties imposed by the Equality Act. And as mentioned previously, none of the decisions that are taken in line with the easements can result in a breach of any individual's human rights in accordance with the European Convention on Human Rights.
Thank you. Anyone?
Next slide, please. Thank you.
Please proceed.
Thank you. In terms of the governance arrangements for this, we were very quick in North Somerset Council in terms of putting our governance arrangements in place in line with the Care Act easements, and these were shared within the South West region and were adopted and adapted by various other local authorities. The process we have in place involves weekly meetings. At one point they were daily meetings, but they're currently twice a week between the principal social worker, myself, the principal occupational therapist, the director of adult social services, and all of the service leaders. And we have discussions around any kind of workforce and demand issues that may be arising. Once a week we have a representative from the Contracts and Commissioning Service. Ordinarily, Teresa Maguire will come and give information in relation to the workforce issues that may be being experienced within the provider market, some of which Gerald has mentioned in his slides, because it's not just about our own workforce within the local authority, our social workers and occupational therapists and adult social care workers. It's very much dependent on domiciliary care workers and care home workers, and personal assistants and others that are providing care and support within the community that we need to monitor. So I've given some of the examples of the things that are monitored: pressures on the provider market, COVID-related staff absence, which can be as a direct result of COVID, but it can also be to do with stress or to do with, I suppose, people being bereaved. There's other things that may sort of fall into that remit. We also monitor the demand on our individual services, and that will include the number of referrals coming in, but also our waiting lists and how many people we have to get through to. In terms of the need to operate under the easements on an individual basis, if there's any specific complex situations involving individuals within the community that arise, we try and unstick them with the professional decision-making forum for frontline staff, and that's attended by myself, the principal occupational therapist, and the service leaders, or at least one of the service leaders chair that. And we're very proud not to have had to go to stage 3 because we think it is very important to meet our statutory duties for as long as we are able. And it would only be if there is absolutely no way of mitigating that situation and we have to take proportionate and limited measures to limit our legal duties would we consider going into stage 3. And that decision would be made partly on my advice, but largely in consultation with Hayley as DAS, and it would need to include the lead member for adult social care and the health and wellbeing board, and there are very clear and rigid governance arrangements around that. If we were to take that decision, we have a duty to inform the Department of Health and Social Care that we are operating under the easement. But as I understand it, no local authorities are currently operating under the easement at the moment.
Thank you. Very helpful. Any questions, anyone? Please proceed. Thank you very much, Richard.
Okay, next slide, please, Leo. So I think there's a couple of slides left. There was a review of the Care Act easements following the first wave of the pandemic, and there was a report that came out of ADAS in the autumn based on other councils' experiences. And I understand that 8 local authorities did take the decision to operate under the easements. They were criticised that heavily, but once things were looked into, the kind of decisions that they took were actually quite similar to people who thought that they were applying flexibilities and operating under stage 2. The places that did decide to operate under the easements were under much more immediate pressure through to high levels of COVID within those areas, which we didn't see in North Somerset in the first wave to the extent that some other places did. So we had more opportunity, I think it's fair to say, to plan how we would respond and how we would mitigate that need to operate under the easement. Those places that did operate under them did take a proportionate approach and continued to meet those duties as far as possible. Most local authorities were able to risk assess and put RAG ratings on the priority of care, and I know we've done that within North Somerset and are well used, as I said earlier, to be able to prioritise care if and when that proves to be necessary. We do appreciate, and I think this has come up a few times today, that when places like day services have closed, that has resulted in significant pressures on unpaid carers who have been taking on a brunt of that responsibility and meeting some of those needs at home. So ensuring that there are ways to support them has been a priority, and I know the emphasis within places like our learning disabilities team has been to undertake regular calls with those carers that are undertaking additional caring responsibilities due to decisions that we've taken to act flexibly during COVID-19. And in terms of being transparent with the community about this, we have always had our position in relation to the easements publicised on the North Somerset Council public-facing website to make sure that anyone who has questions in relation to our position in the easements knows exactly what we are doing.
Thank you very much, Richard. It's questions and comments time. We'll begin with Councillor Harley, followed by Councillor Tucker.
Thank you, Chairman, and thank you, Richard. It's just one comment I wanted to make and see if you've got an answer to it. It's to do with the unpaid carers and family members, and quite frankly, acknowledging, you know, they're very important part in looking after their family. But I'm just wondering whether a risk assessment was taken out on those unpaid carers and family members, because my concern would be, yes, you know, normally when they're the person they're caring for goes to the family day centre, or goes to the day centres rather, that gives them time out. But with the day centres, they couldn't have that. And of course, that was when they had time to themselves. And so basically, these unpaid carers and family members, unless, I mean, the family members may be in a bubble, I don't know with them, but, you know, they will then have to probably do 24/7 care without a break.
Richard?
Yes, thank you for that point. I think the situation would be if someone was in receipt of day services and that was put in place to meet an eligible need for that individual, then we would need to undertake a review if that person is no longer able to attend that day centre, and to make sure that other mitigating steps are put in place to support that individual and to support that carer to make that a sustainable option. And I know that that was happening within teams. I do appreciate that in certain circumstances there will be carers that have very little choice in that arrangement, and therefore it's really important to make sure that they get offered a carer's assessment and access to support themselves, and that too is reviewed. But to answer your question about risk assessment, any review that's undertaken by a social worker following a significant change in circumstances should definitely include an assessment of the risk and the impact on that carer.
Chairman, can I just come back on that one, if I may, just quickly? One of the concerns I've got is actually when you are caring for somebody who's really ill, their personalities change dramatically. And there often is in situations, and I think Councillor Willis and I have discussed this many times, it can relate in domestic abuse and mental health, you know, because they lash out at the person who's caring for them. When you've got people coming in, they're only doing one shift. When you've got somebody doing it 24/7, that is a different set of goalposts. And I really do feel there's some very vulnerable people out there. That's why I asked for a risk assessment. And when you've done it, and you know, and of course anybody, may I just say, who's caring for anybody would say, oh yes, I'm absolutely fine, don't worry, but they're not.
Thank you. Councillor Tucker, indulge me a moment, please. I'd like to bring in Hayley Verico in response.
Yes, thank you, Chair. Councillor Harley, just to give you some reassurance, at the very start of COVID, when the shielding register came out, we worked 7 days a week to identify all of our vulnerable adults within social care, and our practitioners, for 3 weeks, all they did was telephone everybody who we considered to be the most vulnerable to check on their welfare. As Rick alluded to, where we identified that somebody wasn't going to receive all of their services, for example, daycare, we RAG rated all of those individuals in terms of their vulnerability. So I'm quite confident that throughout COVID, we did identify those people. But to be quite clear, as lockdown eases, I am under no illusion that we might find safeguarding concerns, we might find cases of domestic violence, and so we are trying to prepare ourselves over the coming months as to how we respond to those. We also did a lot of work in the early days in identifying those vulnerable adults in terms of referring them to Gerald's Wellbeing Service, and they picked up an awful lot of people. And we did also link people in with the wellbeing collectives and the community and voluntary sector. And even when daycare was closed, we changed the provisions so that the people who were working in day centres actually provided welfare calls, and they continue to do that so that we can try and pick up on some of the issues that you've identified.
Thank you very much, Hayley. Councillor Tucker.
Thanks, Chairman. Thank you very much for the presentation, Richard. Yeah, the councils that were operating under easement, I think you said there were only 8 of them. Were they mainly the sort of big urban councils then, with obviously very big populations, very dense cases of COVID, I guess. Is that pretty much the pattern, or not necessarily?
I think, I can't remember exactly which councils, if I'm being entirely honest, but I think there was a group in the Midlands where they were significantly impacted, and it would have been larger councils. All of the councils that did operate under the easements, the information is available via the CQC. So at any given time, you can look to see which councils are operating under those easements for transparency. I'm not 100% sure that you can look at the councils that were operating, but it's a matter of public record, so it'd be easy to kind of look that up, and I could get that information for you.
That's all right. Thank you very much, Richard. Thank you.
Thank you, Richard. Councillor Willis.
Thank you, Chairman. Excuse me, like Councillor Harley, a number of conversations have been had over the years for informal carers. Haven't been one myself since I was very young, apart from 3 years of my whole life. Carers, as Hayley will know, we have an unknown list of carers. We have people who aren't registered as carers. We have people doing the job every single day because they just think it's what they have to do for a loved one, and they don't ask for help and they don't want to come forward. It's those people that I think Anne and myself have the concerns about. And I know it's difficult to find those who don't want to be found, but we do have a vast volunteer community groups now within COVID, within the parishes and the towns and neighbourhood areas of people who've been going out, helping collect prescriptions and deliver foods and all those bits and pieces of keeping an eye. And I wonder, I know it's under safeguarding and all those bits, but I wonder if there's a piece of work that we could do when we're out of this awful situation to link with those groups to find out those unknown carers, because I know of people that are right on the edge of caring responsibilities. As Anna said, we're 24/7. It doesn't stop. And there are days when you think you're going to go absolutely bonkers, and you can't get in your car and go anywhere and go and see the sea and say, thank you very much, sea, get my brain back into gear, because you can't leave the person and you can't go out anyway. And, that's just without any domestic abuse cases.
Yes,
where I've been supporting people the last year. So I'm wondering if there's something that we can look at from this panel for those issues around those unknown carers with the work and build on it.
Thank you, Councillor Willis. We're actually working on the provisional work within the working plan for a carers inquiry day later on in the year, and we've begun the working the foundation work on that, and that's exactly what we are aiming to, the audience that we're aiming to talk to and learn more about. Hayley?
I'll give way to Councillor Harley first, Chair.
I think, Anne, have you left your hand up?
You have to bear with me that my little yellow hand is not going down when I press it, and it's not going up when I press it. So just take that as read. No, Hayley, I've said what I want to say. Thank you.
I can take it down after you've spoken. That's fine.
Thank you very much. Hayley.
I was just going to say, Chair, if there's no other questions, just to thank Rick for an excellent presentation, because it can be very difficult to explain something as complex as this. So I just want to say well done to Rick. And I hope that Rick has given you the confidence that throughout COVID, and despite the many challenges, we have provided a really good quality of service to provision to our most vulnerable residents. Our staff have been really flexible. They've worked out of hours. They've worked over 7 days a week when they've needed to do so. And they've been really adaptable. And it's because of that that we have been able to safeguard our most vulnerable residents. We have carried out our Mental Health Act statutory responsibilities and DOLS, as Rick mentioned. And at times, particularly just before Christmas, what the committee probably won't be aware of is that we actually went into one care home and provided hands-on care because there were so many staff sick in that residential home. And we did that because we didn't want to move very sick and very poorly people. So I just want to say congratulations to all of the staff. And I think Rick has reflected the challenges really well today, so thank you.
Thank you very much, Hayley, and once again, merited applause for the efforts that that the team has put in, really. Ros, are you coming back on a response to that?
Yeah.
Yes, just very quickly, Chairman, really to echo that. I know throughout the last year, the problems from residents, etc., that I've been trying to deal with, and you know, regardless of how busy Gerald or anyone else has been, he has helped to maintain the services and help sort out my crisis queries and everything else. And I, you know, with the care homes as well. So I do fully appreciate what staff have done, and I think you know, the plaudits cannot be great enough for it. And I do think some media needs to be done on it for some backslapping and hand clapping from us as councillors on a media bit to go out for staff when this is done, because I really do think, you know, we have outperformed actually as a council for our officers.
I agree, absolutely. Hayley, is there something specific you want to highlight? Your hand's up at the moment, because I'd like to move on as quickly as possible to the mental health support pilot.
No, I've taken my hand down, Chair.
Thank you. Okay, I believe that this is being presented by Martin.
Yes, again, Chair, would you allow me just to open it up to give some context?
Absolutely.
Thank you. So we do know that as a result of COVID, the mental health issues have increased for many people. I'm very well aware of the fact that we have moved to remote assessment, and at the same time, we know that GPs are doing online consultations, and so I am concerned that some people with very low level mental health problems might be missed. And so anticipating an increase as lockdown eases, elected members agreed to give me a £120,000 growth bid to develop and pilot an in-house mental health support programme. So I'm going to introduce Martin Hawketts as the service leader who is leading on this piece of work to explain what we're trying to achieve and what we hope the outcomes will be. Leo, I believe that you've got the presentation. Thank you. Over to you, Martin.
Thank you, Hayley. Thank you, Chair. Good afternoon, everybody. So I've just got a few brief slides here just to talk through the context of what Hayley was describing there, which is setting up a new support pilot project for mental health. So we're going to go through some of the kind of service model that is based on, and then just a little bit of a detail about the project itself. So if we want to just move on to the next slide there. So I've just pulled up here a few statistics from NHS England. This is really just to set some of the wider context of mental health need. Now, you know, mental health has been very much highlighted, I think, throughout the pandemic, and there almost isn't a day goes by when we don't hear something about it on the news. And we can see from some of these examples here that this really is a very significant problem. And it's my own personal view that the pandemic has highlighted a mental health need rather than exactly created it. I think without a doubt we will see more mental health need arising as a result of COVID, and the legacy of that I think will go on for some years. But certainly this was building on an issue in society that was slightly wider. One particular statistic I think there that's very interesting is that common mental health problems are twice as highly among people who are homeless, and compared with the general population, and 15 times as high for people with psychosis. So there is a very strong link between mental illness and being able to being able to maintain decent housing. So that's perhaps one of the things that underpins the need to be able to support people more freely. So if we can move on to the next slide. So the next couple of slides are just going through the context of what our service model in mental health services looks like. We are very much trying to deliver our services within a recovery model, and some of the kind of characteristics of that are we're looking to really try and maximise people's independence. And I think we all know, don't we, that mental well-being comes from achievement, it comes from living a good life, it comes from being capable, being independent, having employment, having friends and family. I know some of these things are difficult at the moment, and not being reliant on services, not being in that constant sort of mental health system, but being out of it. We don't want people to be in services for too long. We want to be able to support people and take them out to live a good life. We want to be able to focus on people's strengths rather than their deficits, and I'm sure that members have heard the strengths-based model being spoken about quite a lot as something that we're trying to really promote in social care, and I'm sure that Hayley has spoken to you about that. Similarly, positive risk-taking is another element of that model. Positive risk-taking is where really you are balancing people's independence against the risks, because any kind of independence has an element of risk, and I think anyone who has had children will know this. I think that's a particularly interesting conversation in the midst of COVID, and perhaps that could be a very long conversation, but we won't get into that today. And of course, everyone is different, and people require different care at different times and for different durations. So we do need a bit of a mixed marketplace around mental health. Chair, I'm noticing some hands have gone up. I can't quite see everyone's.
Martin, in this case, with respect to how it's laid out and the information that you propose to present to us, I would suggest at this point that members reserve their questions until the end of the presentation.
Yeah,
Thank
absolutely. So if we go on to the next slide. Okay, so what I've done here is I've tried to create a simplified diagram of the research and models around how mental health services should be laid out. So this is my own model. I haven't pinched this from anywhere. And what this essentially shows you is that you have a pyramid where at the bottom you have the lower level preventative kind of services, and at the top you have the really intense services such as people who need to be in hospital due to very significant mental illness. And essentially what you are trying to do within this model is you're trying to have less people at the top of the pyramid and more people at the bottom of the pyramid, and to try and push people into the lower ends, to try and help people who have needs to be managed at lower levels all the time, and reduce the amount of people that you have at the upper tier. That's the tier of basically, admissions into hospital. Now, we understand this model or this very well when we're talking about physical needs, because we all know that if we eat well and we do a bit of exercise and we look after ourselves, then it prevents us having long-term health problems in the future. And the same logic is true of mental health, that if we invest in the preventative and we invest in the lower level, it should lead us up and prevent people entering the top of the pyramid. Now, of course, one of the challenges, and perhaps the big challenge with this, is that investing in the lower levels, which we're hoping to do with this particular project, doesn't necessarily pay you back quickly. Prevention takes several years to come into effect. And if you have more people in the upper echelons in the hospitals, that of course inevitably takes in more and more resource and more money to manage. And so the big challenge for any health and social care system on kind of a national level, I think this is how you can take your resources out of the top of this pyramid and put them in the bottom of this pyramid. Because the evidence and the research shows that you should push your investment downwards rather than upwards. And the more that you push your investment upwards, the more you become a system that responds to crisis, and the more you push it downwards, you become a system that responds to prevention. to give you sort of an example, I mean, obviously things get more expensive the further you go up. So someone in a hospital can, I think it's on average a mental health admission is £500 a day in NHS, but obviously that varies region to region, but that's a kind of very broad figure. So, you know, it's extremely costly. It's not, however, simply a financial question. It's not a question of we want people to move down this pyramid because we want to save money. It's also a moral question, because actually what we don't want, as I said before, is people to be in care services, to be in long care processes and to be dependent. We want people to be independent and live good lives. And so actually dealing with that lower level is the moral thing to do. So if we're okay, we'll move on to the next one.
Please carry on.
Yeah.
As I said, members, we'll take questions at the end. Thank you.
So we are going to focus, and the project that we're designing at the moment is focusing on the shorter term interventions to maximise independence. So the kind of third tier of the pyramid that I've been talking about. And what we've tended to find is people of working age with the first first kind of presentations of mental health. What we mean by that is people who maybe are first presenting to mental health services with a problem, or lower level mental health issues, tend to present with issues around the following things that I've highlighted here. So it's housing stability, maintaining tenancies is a very big problem. Activities of daily living, by which I mean just household and financial management, so getting on top of things, managing your bills, sorting out your shopping, all of that sort of stuff. Keeping social connectivity and linking up to community facilities, and of course accessing and maintaining employment. Now, what we've found that the need for these kind of individuals is to have fairly kind of short-term, relatively small packages of care to take them through a short period of time to assist them with these things. Now, often those services are not particularly easy to commission or gain from the private sector, and that's an issue of, first of all, the scale of those packages, and also the kind of skill levels involved as well, because there's different things. So this is partly the reason why we were saying bringing this sort of support in-house is likely to be able to link it up with the professional assessments, link it up with the professional support in the mental health teams, and be able to deliver these quite small, intense programs to people so we can help get them through difficult periods of their lives. So we'll run on to the next slide. The difficulties we find by sort of not having this kind of service in place, not having this ability to respond to these lower level needs and provide an immediate and intensive support to people. What we find is that you can end up with overprescription. So you can end up giving somebody too much and then pushing them, you know, up the pyramid accidentally, and then creating a dependency which isn't necessary. And of course, it's an inefficient use of resources to put too much care into someone who doesn't really need it at the wrong time. You know, what we need to do is to want to be more efficient and people at the right times. And of course, it leads to greater costs over the longer term. And so finally then, the final slide, is the proposal we intend to make, or the service we tend to develop, is we're going to start by employing 2 members of staff over a 12-month pilot period, and those members of staff will be based in and managed by the adult mental health teams, and those mental health teams are integrated with our health partner, the Avon and Wiltshire Mental Health Partnership Trust, and so we have a fairly mature integrated relationship. We've been working together for many years, so they'll be based with both health and social care professionals, and they will deliver these structured short-term interventions, as I've described, under the direction of those professionals. So we don't want them to get sucked into all the day-to-day work. We want to create a very distinct service that the professionals refer to and work with to deliver a very particular set of very particular piece of work and a very particular outcome. We're scoping the service to work with something like about 50 or 60 people. That's the kind of numbers that we're working on at the moment. The outcomes we're seeking to achieve from that is what we would actually like to do is whilst this isn't tied particularly to the financial outcome, we would want to see this be able to mitigate against our use of more traditional commissioned care services. So we'd actually hope that that would reduce the bill in regard to that, because we'd be putting that need somewhere else. We would be hoping to maintain current or new housing provisions, so we'd hope to help to stabilise some people in their housing circumstances to stop people going into crisis. And of course, we'd like higher user satisfaction. And we're beginning the recruitment to these roles. I actually wrote the adverts for them on Tuesday, so they should be going out next week or the week after. And the deadlines for applications will be around the end of March, beginning of April. And hopefully by the time, if all things go to plan and we can get people in, we can get the service up and running, we should be able to get things going by June or July, which would, one would hope, coincide with a time when COVID restrictions are less strict, and so we'll have a lot more scope to provide the service out in the community. So that is a very quick sort of whistle-stop tour of the model of services and the proposal that we've put in place based on the funding that Hayley mentioned at the beginning. So I think now we can do questions, Chair, is that right?
That's correct. Thank you very much, Martin. I remember this project when it came through on the medium-term financing, and I thought, how great, just loved it. And you've attracted a big audience of questions. So we'll connect with Councillor Harley, then Councillor James, then Councillor Havison, then Councillor Willis, and then Councillor Griggs. So, Councillor Harley, over to you.
Yes, thank you, and nice to see you again, Martin.
Nice to see you, Councillor Harley.
Yeah, long time no see. Well, my question really is, I mean, I think this is a wonderful idea, actually, but my question is whether somewhere along the line we could involve the younger people, the children, you know, like the Children and Young People's Scrutiny Panel or whatever, because I foresee, and I'm not a doommonger, but I foresee there's going to be a lot of people coming out of COVID, young people with children and children with mental health problems. You know, you identified the adults that maybe have lost their job, and the whole change is going to be ginormous. And so I'm just wondering whether there's any way we can gather information from that section to feed in to your scheme that you're doing, because otherwise we could be looking at a similar point and doing a bit of duplication.
Over to you, Martin.
Yes, I've had some very brief conversations with colleagues around how this project could interface with work that they're doing around parenting, because certainly I think there is an issue around parents who may also experience mental health difficulties and then their ability to look after children, and that's perhaps an area of crossover. So, and I know that there is some work going on in the children's world around that kind of thing. So I don't, with this particular project, we hadn't particularly pitched it at that area. It was more around individuals with mental health problems rather than around children, but I think that's an area we could explore. Certainly, with this being a pilot over the next 12 months, that gives us the option to be quite broad and flexible about what we do with it. And I don't want to be too prescriptive about saying we'll only work with particular individuals. We want to be able to take quite a broad view. So I can certainly continue that conversation with children's colleagues.
Thank you very much. Councillor Havison. Sorry, Councillor James, my mistake. Councillor James.
Thank you. Myself and Kieran Cronley as the Youth Champions are happy to talk to you if you ever do want to speak about mental health issues. As Health Watch have said, they've also done a very extensive bit of work on that, but I'm sure you're aware of that already.
Yes.
I know that when I was at university, I would have really valued a low-tier mental health resilience sort of support. I went straight to IAPT because it was the only service available. I know there's a feeling that a lot of my friends share that if you want mental health support, the only support that's really there. At least there's a feeling that there's only support there if you have immediate risk to life, which is a pretty costly and expensive service model. I'm glad we're investing in 2 staff members. In terms of the number, 50 to 60 users, is that what we expect the level of need to be? And is that what we expect the need to be if there's outreach? If there's outreach done? Because I know that off the record, as in the Bristol charity, not me talking off the record, they're really good at outreach, and because of that, they're really, really oversubscribed. So do you think that we might have a similar problem if we do?
It's very possible.
And I've stopped.
Sorry. The 50 or 60 is based on partly what our understanding of the need is now coming through the mental health recovery team, and it's also based on what the capacity of 2 workers will be, because clearly, 2 workers is a finite resource, and so we have to, in some ways, say what we think we could work with. So it's a sort of combination of both. I think it would be very interesting over the 12 months to, and one of the things we will obviously be doing is looking at the outcomes and the measures of this project quite carefully. And if it's hugely oversubscribed, I think that tells us something, doesn't it? So it's a bit of a work in progress. I think one of the other points I'll pick up with what you said was, I think it is widely acknowledged across the mental health system that there is a gap that exists between primary care, i.e. the sort of support you can get from your general practitioner, and secondary care, i.e. the support of specialist mental health teams, and that the criteria of those specialist mental health teams has become rather high. And it does tend to centre around immediacy of risk or very significant mental health needs, and that there is an acknowledged gap that exists between those 2 things. And one of the very much larger pieces of work that's going on at the moment within the clinical commissioning group is around a whole system redesign of mental health community services, and you may have come across that. And there's money coming through from NHS England to support with that. So there is an acknowledgement by the health system that does exist, and there are some attempts to examine that and to examine a more holistic approach to it, rather than having all these sort of lines of criteria that exist that people come across.
That's really good to hear, and hopefully that's where the whole integrated the integrated model should become really helpful, I suppose. Do you think that will cover this sort of area, or
Yeah, I mean, as I said, we already integrate with secondary mental health services in North Somerset, so we already have an integrated service, and that's been running for some time. There is work around the integrated care partnerships, working around a locality model, and probably Hayley is better placed to comment on the detail of that than I am. But certainly there is a push that the mental health system should integrate with that work, should come on board with it and be part of it, rather than be its own separate process. It should come alongside the integrated care partnerships and work in that way, in a more sort of whole system approach.
Fantastic work. Thank you very much.
I'm aware that we have quite a number of people who wish to speak. Councillor Havison.
Yes, thank you very much. I really want to welcome this initiative, because I think this bottom-up approach and prevention rather than cure at the end when things have escalated is massively important for people, but also for our finances. So it's a win-win situation. So yes, I really, really welcome this. We also welcome the approach that highlights the link between housing and mental health issues. I think that needs to be explored, and not only has it an impact on our approach, how we tackle homelessness, but also the security of tenure of some of ours, which I think is going to be a massive problem when we come out of this pandemic, because there'll be an awful lot of people who are in rent arrears. And I think we need to really put all our efforts into preventing them being evicted, because at the moment there is very little security of tenure, and I understood that there was a government bill in the pipeline that was going to attack that, but believe that has been shelved now, and that really concerns me a lot. And I think that we really need to give our private tenants a lot more security of tenure, because it'll have impacts on our mental health as well as many other social issues. So yes, thank you very much. This is a brilliant initiative, and I really support it.
It is very common within mental health and those with mental health needs to often bounce between different housing providers, because if they can't maintain a tenancy, then housing provider will end up becoming evicted or losing their tenancies, and then this can spiral out of control. And by way of example, I'm sort of rather sad to report, I mean, there are currently 3 individuals in psychiatric ward today in Western General Hospital who are effectively homeless, and there is very few options in which to house them, because of course we are relying on social housing and private sector landlords and etc. etc. So and that is now live today, that I could highlight 3 individuals who are in that kind of really precarious housing and homelessness situation.
Thank you very much. Councillor Willis.
Thank you, Chairman. Yeah, really good. Can you hear me?
Yes.
Hello?
Yes.
Oh, sorry. A really good. Sorry, I'm blind here completely. I don't know what's going on. It's a really good start, and I'm pleased with the initiative. A couple of questions. So, will it be linked with the new Boulevard Crisis Centre, etc., that's happening? Will it be working out of there or with there? Will it also be linking with our voluntary sector and our third sector, as with Addaction and maybe the Pride, etc., around those issues, and some of our domestic abuse charities? Will it be working with that, or are we doing this specifically for our own mental health that we know of within our own group? So that was my questions for that, please.
Okay, the Boulevards, you'd be talking about the Safe Haven Centre, which was commissioned by the CCG. We haven't specifically linked up that project with the Safe Haven Centre, which is now moving back from being a telephone-based centre to being a more face-to-face thing. The goals of that particular centre were to try and divert people who were going into crisis from taking the A&E route. Because this particular service will be part of, in effect, an extension of the existing mental health offer, then there may be referrals through from the Safe Haven Centre through to the teams that then could be picked up by this service. It's not directly linked as such. In terms of the voluntary sector, yes, without a doubt, we would want these particular workers to be very linked into the wider resources that are out there in the mental health sector, and be able to hand people on or pick people up from those particular centres and those particular ways of doing things. One of the other things that I see could be very useful within this service that we've thought about is being able to use these workers to help facilitate people's access to other things. Sometimes individuals with mental health problems are very wary of maybe of having care packages or going to social events or going to the Safe Haven Centre, you know what I mean? And so we would try to use this service to help facilitate people's access, to sort of hand people over to do a kind of structured move between one thing and another thing. I think too often, potentially, we could abandon people to the system. We give someone a number and say, ring that, and then assume that they might do, whereas we would do something more active in terms of handover.
Thank you very much, Martin.
Just very quickly, Chairman, on the Safe Haven bit. May I just on the Safe Haven bit? So, we've got that is coming online. Would there not be some chance of sharing finance people, etc., to be able to enhance both services? It does seem a safe way to go, and it does seem a more sensible way to go in for finances? Is they're setting that all up and it's all being done? Thank you.
Thank you. Thank you. Councillor Griggs, followed by Councillor Cato.
Just a simple question from me. What is the employment market like in this area of experience, and will it be relatively easy to fill these two roles?
Generally speaking, we normally, with this particular roles at these particular grades, because without putting this too bluntly, the kind of remuneration one can receive from council is greater than that which you would have in the private sector for a similar role, and so we are offering, something that's effectively a little bit enhanced. And when we've advertised similar kinds of roles at similar grades, we have always had very high interest. So I would anticipate roles would be relatively easy to fill.
Great.
And
Thank you.
Will have, of course, there's always the case of one robs Peter to pay Paul, and you will take an experienced person from somewhere else. But
everyone here knows that. Everyone here knows that. Thank you very much. Councillor Cato.
Hello, just a couple of questions, really. My first thought is, how do people first present at the lower tier, as it were? You're trying to capture the people before they get into the higher levels of issues, as it were. How do they first present?
Normally in mental health services, it would be by referral from their GPs, normally. That doesn't mean that people can't make self-referrals either. They may come in through our Care Connect, which of course you'll be familiar with, or they may come in through the mental health's own system. Mental Health also have, AWP have now also opened a 24-hour support line, and we're hoping to link with that as well to pick up some data from them. But as I say, normally this would be via their GPs, so GPs would normally be highlighting people and sending them across to mental health services, but not exclusively.
Okay, so Martin, I mean, I love the work you're doing, and I think it's really absolutely sensible that you get it really early on. And part of my question is around that is, I'm aware of people who haven't been to their GP, so they're evident they're suffering from mental health issues, but they haven't actually got into the system yet. And so it's like the pre-system, in order to deal with mental health and well-being, one almost needs to do something before they even show up.
Yeah.
And the question is, what thinking might be able to go on in that kind of domain of dealing with issues before they show. I've just been for a dog walk this morning early on, and I met somebody who was clearly would need some support, but they're not in the system.
Yes. I mean, clearly this particular project, this particular pilot is a relatively small scale pilot, and it is geared towards people that we will know about and we will become aware of through the usual systems. I have to be clear about that. There is interesting work being done elsewhere in the country around more assertive outreach approaches, whereby services actually go within the communities and seek people out. I mean, clearly our services now are generally responsive to somebody referring to us in some way. And that is really what this service will be about. It will be responding to the need that we can see, not necessarily the need that we can't. And I do take the point that there are undoubtedly people out there that are unseen. And I think that came up in an earlier discussion around certainly carers and around some of the domestic abuse issues that may be going on during COVID. So there are various models of services throughout the country that have taken a look at that, which I think would be interesting to develop perhaps. But as I say, this model is, to be fair.
I understand this model. I'm thinking if you could somehow keep it on your radar. I'm thinking maybe some of the work we've got going on with the library services and integrating that and providing that as community wellbeing centres in a kind of subtle way, that people get picked up through there. I don't know. And the other question I would like to put, maybe you already do it, is in terms of whether an individual who presents into the system, as it were, if they're moving from one part of it to another, do they have a unique identifiable champion, as it were, to take them through, so they're not being passed from one person or one group to another without having a consistency? So I'm thinking if you're needing the support, then what you need is a champion that is your champion. Whenever I've got an issue, wherever I am in it, I speak to whoever it is, who has longevity, if you like, who's, you know, not being changed regularly. So I'm just posing those two thoughts.
Yeah, I mean, to some extent, there are those roles do exist within secondary mental health services. We have the care coordinator role that oversees somebody's care, but it's still episodic in the sense that if someone is discharged, that care coordinator goes away. So I think to some extent that does happen throughout the system, but probably in general terms, there isn't. The system is compartmentalised to some degree and doesn't necessarily have a single individual that threads all the way through it.
And this is kind of typical. Very often in terms of doing our best to provide services and things, but it feels to me like having a single point of contact, a single, like, person-centered, I'm thinking, is rather than compartment-centered.
There is a piece of work that's currently being developed in the CCG. I was talking about it to colleagues only this morning around the CCG having successfully received some bid to create a coordinator role similar to what you describe around transitionary work, because transitions from childhood to adulthood are tremendously complicated, as I'm sure you're aware, and so there is some thought being given to having a single coordinating role that would cross all the various agencies around that incident. So I think it's recognised that is a useful aspiration, certainly, but I don't think it is something that happens everywhere all the time.
No, I appreciate that. So I'm not particularly looking for an answer right now. I'm just posing those as things for consideration.
And first of all, can I just say how welcome your interest is in this, members, really. We do need to move on, and I'm quite happy to arrange an informal event when members can perhaps explore this in more detail with the relevant team. Hayley, I'm turning to you for final comments. You've had your hand up all the time.
Yes, thank you, Chair. I hope that Martin's presentation and this pilot that we're establishing just gives you the confidence that we are reacting to what we think will be an increase as an outcome of COVID. And I think if it's successful, we could look to expand the service. So as Martin alluded to, we will be evaluating the outcomes all the way through. And I wonder, Chair, whether a 6-month report back to ASH would be helpful to keep you informed of its progress.
I think members would welcome it, absolutely welcome it, and the cat as well. I think the cat would probably be very supportive. Okay, Councillor James, briefly, please, because I would like to.
Yeah, I really understand that. If we do have another discussion on this, I think it might be useful to bring in the chair of HOSP, just because to bring cohesion, because there's a lot of mental health chat on HOSP, and I think this really fits the scope.
Yeah,
absolutely. Can I therefore at this point turn to Catherine, I think it is, who will give us the adult social care budget monitor overview. Thank you very much.
Thank you, Chairman. So good afternoon, everyone. So this is the usual budget monitoring report that we bring to you at each of your meetings. This is the report. It's based on the month 9 forecast, and so it builds on, I think, what went to the executive earlier this month. So in summary terms, I won't take up a lot of your time. I realise that you've got some other items still. So in summary, we're reporting an overspend of 5.2 million. Of course, members will be aware that the vast majority of that relates to additional expenditure that has been incurred as a result of the COVID pandemic. So £4.9 million of the overspend does relate to the COVID pandemic. I think the best thing for me to do would be just refer you to the bullet points that start at paragraph 3.2, which I think are the kind of main messages in the report. So what's interesting to note is that the budget has been increased by almost £7 million, and that's to reflect the receipt from government of a number of particular funding streams that we have then kind of dispensed to providers, and Gerald referred to this earlier on. So there's been a whole bunch of additional grants that have been given to local authorities to then distribute to adult social care providers. So members will be aware of the Infection Control Fund. We've also had some money for the Rapid Testing Fund, and also most recently the Workforce Capacity Fund. So there's a table at the top of page 3, which shows that at the time that we wrote this report, the amount of money that has been dispensed to providers, some of it from government in relation to those schemes I've just described, but some of it also in relation to temporary fee uplifts that we gave to social care providers in the early part of the pandemic. So Gerald, I think, referred to £10 million that we have dispensed to providers over the course of the past year, and indeed it does now exceed £10 million since we've written this report. I think the other point to make is that whilst we are reporting this overspend of £5.2 million, that's largely because the general COVID grants funding that the council has received hasn't been allocated to directorates, if you like. So it plays into the council's overall position, but there's been no allocation of that money to directorates. So if members will recall, I think what was reported as far as the council's overall position, the council isn't reporting an overspend, and that's because we're playing in this £14.6 million general COVID grant into the bottom line. The other thing to note is, what constitutes the overspend in relation to the pandemic. So most of it relates to those temporary fee uplifts that I've described earlier on. So right at the beginning of the pandemic, we paid £100 per placement to residential care home providers, and an additional £1 per hour to domiciliary care providers, and that amounted to around about £2 million, just over £2 million. And then we're still holding contingency of a further £2 million, which we might need to use a small amount of that, I think, in this financial year at least, to continue to support providers. We've made some small payments to providers, as Gerald has described, in relation to particular outbreaks and additional costs that they have incurred, particularly in the recent couple of months. And the rest relates to things like PPE that, again, Gerald has described. So clearly the vast majority of those spend relates to COVID, but there is also a small, what I call business as usual pressure. So across all of the individual care packages, that amounts to around about £700,000. And really it's a combination of quite a few things. So we are seeing, as you'd expect, quite a big underspend on residential care placements. That is obviously due to under-occupancy of residential placements, but also due to the fact that the NHS has provided funding for hospital discharge packages during this period, which clearly isn't going to continue into the new financial year. So we've got an underspend on residential placements, but that is being more than offset by increases in exceptional special needs placements. So that's placements in residential and nursing care where additional support is required, and also an increase in domiciliary care as well. So overall, the kind of combination of those factors means that we've got an overspend of around about £700,000 across the whole care packages, but that's offset by some underspends and some savings, in particular in contracts and commissioning. I think the only other...
Sorry, carry on, Catherine, sorry.
Would you carry on? Yeah, sure. OK. So I think the only other thing I would just want to point towards would be paragraphs 311 onwards. So it just refers to the medium-term financial plan. Just wanted to make sure members were aware of what was contained in that and the budget setting process that was finalised at council earlier on in the week. So there is an additional £4.6 million in the adult social care budget to take account of cost inflation and projected increases in demand. But as well as that, we have a savings target of around £2.5 million. And members can see the areas that we are focusing on to achieve those savings. And then finally, I'd point to the risks. And again, Gerald has mentioned some of these, and it's kind of obvious from some of the reports that you've also received today where those pressures might come in the future. So clearly there are increasing costs in the provider market, and the financial stability and sustainability of providers is of concern to us. It's clear that there is suppressed demand for services during the current period. Part of that is, as I said, due to the NHS funding some of hospital discharge packages, but also there's clearly a potential increase in the demand for support. And Martin's talked particularly about mental health, and I've heard conversation about carer support as well. So that is definitely a risk in terms of a likely increase in demand. And as I said earlier on, we've got a £2.5 million savings programme to deliver, which might be quite challenging.
Yeah.
So I guess all I wanted to say, but obviously, as always, happy to take questions.
Thank you very much. We'll begin with Councillor Willis.
Thank you, Chairman. I apologise for two pussycats, but they do like to watch bird programmes on the television, and they all think you're birds because you're talking. So that's why they're joining in. They keep getting on my lap. So thank you, Catherine. So the query is about the COVID monies. That it hasn't been allocated, and you know, with the amount of extra work that Ash are having to pick up around, does that mean, you said they put into the general reserves? I was going to ask the question at budget, but I couldn't get in on Tuesday for it. So does that mean that Ash will have to bid into council to get their monies, you know, to top up? Because we have got the 3%, yeah, but that's on council tax, but we've got extra on top of that, you know, huge processes happening. So does it mean that each directorate's going to have to bid to the executive or into council to get that grant money, which has come specifically COVID money to deal with? Thank you.
Yes, thanks, Councillor Willis. So it's more about a technicality, really. So instead of that 14.6 million being specifically allocated to individual directorates, it's been just allocated to the bottom line in order to balance the council's budget. Should there be some funds or some funding carried forward into next year, which is a possibility, clearly we'll need to bring in a mechanism to decide how that funding gets distributed amongst the many pressures that there are going to be clearly in the new financial year. Adult social care being a predominant one, but equally, you know, there's going to be pressure to fund, you know, economic recovery. There's still pressure on leisure providers, on transport providers. So there's a whole bunch of pressures that the council is likely to see in the new financial year, and we need to make sure that we've got a proper mechanism in place to make sure that that funding is allocated appropriately to those individual services. So yes, it's very, very much in our mind, councillors.
Thank you very much. Councillor James at this point has invited me to suggest that a 5-minute break might be helpful. It would be for me, I know. And so please indulge us, Howard, on this point before we come back to your particular item. I know it's a long.
Chairman, I'm not in favour of a 5-minute break. I mean, we're nearly at the end of it, and quite frankly,
yes.
you know, we've got other things to go to.
Nearly at the end of it. We are close to the end of it, but we're not nearly at the end of it.
No, but we've got other meetings to go to and other responsibilities.
I'm not going to apologise for the fact that this meeting is COVID centred, that we have that issue on at the moment, and the core of the things that we've discussed at this point seek to deal with that issue. We have what is this? We have 3 meetings a year for this panel to get together. So I am going to suggest that we have a 5-minute break, and we will come back to this meeting in 5 minutes.
Well, I'm sorry.
I'm not going to argue about it. Thank you very much. Thank you. Right. Thank you, and I hope the break was helpful. Members will recall quite some time ago, well over a year ago, and certainly in the early days of this particular panel, that we talked about the private rented housing sector and the regime that had been introduced at that point. Now, it wasn't appropriate in the following 9 months or so for us to look into that in greater detail, but that opportunity now does present itself. And I'm very pleased to be able to invite Howard to give us a fresh insight into how the private rented housing regime is functioning at this point. And at this point, without further ado, I'll hand over to Howard Evans. Thank you.
Yeah, thank you, Chairman. I'm unclear exactly what you can see because all I can see now is my presentation. So I'm assuming you can all see the presentation.
I can certainly see it.
Some pretty pictures of North Somerset.
Yes, Chair.
Right, good. Carry on.
You should be able to recognise it. It's got some scenes of North Somerset.
Yeah. Yeah.
All fine?
It looks like it.
Yeah,
good.
That's fine, Howard.
Yeah, just as sort of by way of introduction. All okay, good. Yeah, just by way of introduction, yes. I think we've embarked on a sort of a program, and this presentation is really just to give you a sort of a snapshot as to where we are and where I think we are, and possibly sort of take your input as to where you think we might be going. So there's only 10 slides, so it's hopefully shouldn't take you sort of as too long, because I'll give you some time there for some questions. So here goes. In essence, just so we're clear, like obviously the private rented sector covers quite a broad range of sort of property types, through from sort of houses, but sort of right through the list there on the left hand side. So we're not sort of singling out any particular type of property, because across North Somerset we've got quite a range of properties which are effectively in the private rented sector. Like surprisingly, you'll find like some park homes are classed as private rented, because obviously they are rented out as well. That's just by way of one example. You'll be well aware, obviously, the corporate plan sort of lends itself to supporting what we do to improve housing conditions, certainly sort of improving health outcomes, community cohesion, to flag about sort of the carbon reduction, the sort of link to the climate emergency, but also more sort of increasingly we are sort of discharging our homelessness duty into the private rented sector, and I'll come back to that sort of later on. The way we approach it is to have strong enforcement of the standards that apply to the sector. There is in place a national mandatory sort of licensing of houses in multiple occupation, and something which you may not realise is that in North Somerset we've got 134 sort of licensed HMOs. The majority of them are actually in Weston-super-Mare, which will possibly come as no surprise. But as I say, they are usually properties that have got shared accommodation. So there's usually more than 5 people sharing either bathrooms or kitchens. That's by way of a description what they are. And I think importantly, I should mention that we work quite closely with private landlords, because I think we mustn't forget them in this sort of process. There's just a photograph. There's a limited number of photographs in here because I must sort of protect the innocent, basically. So hopefully it just gives you a flavour of what we occasionally sort of come across. To pick up the what we term the area action approach, we embarked upon this sort of following a comprehensive review of housing conditions in 2018, which is, yes, focused on the poor accommodation we identified in central Weston-super-Mare. The approach starts with education and promotion to landlords, but is backed up by very strong enforcement. So we took the time to update our enforcement policy, which now includes civil penalties. Now, these financial penalties, and you'll see in one of the later slides as to sort of some of the impact of that, or potential impact of that. We were also preparing, as I say, for an expansion of the HMO licensing regime, which had some impact on North Somerset in increasing the numbers that we required to license. There was other changes that the government had introduced in the sector, particularly around gas safety, energy performance certificates, and also, and I'll touch on it shortly, about the tenants' rights reform and where that is. And I think, again, it's fair to say that the local landlords kind of embraced self-regulation, and they gave a clear commitment to that education and training, which I think was quite encouraging for us, because obviously, sort of, I think without the landlords being on board, then I don't think that we would achieve where we've got to today. This slide sort of gives you sort of like a snapshot in time as to where we are. And it started right at the beginning for us to identify what was the numbers of the private rented stock in the area. And this is I say central Weston-super-Mare, but it does extend into Milton Ward, the hillside, and partly into not South Ward, the Clarence Park area. Forgive me if I can't remember what the word is called, but I'm sure members will know what I mean. So the numbers we have identified are there's about 4,500 private rented sector dwellings in the area, and that could be a combination of flats, self-contained flats, shared houses, bedsits. So it gives you a flavour. It's like these are not all individual flats; it's a combination of that. So as part of that education, we've sent out, as I say, just under 3,000 letters to landlords, which directed them into sources of the information they needed to ensure that their properties met the required standard. It doesn't match up with the total numbers of dwellings, because you obviously have some portfolio landlords that will actually sort of own several properties. So clearly we only wrote to them once. The next sort of bullet point there just gives you a flavour as to the number of what we call improvement notices under which we've served under the Housing Act. Now this is where we would have found an actionable hazard, and obviously sort of requires us to serve a notice, because having told the landlords that they need to meet a standard, part of the deal was we told them that if when we come and inspect your property, we find hazards, we'll go straight to enforcement, and that's the approach that we're taking. So in sort of 1920, we served 12 improvement notices, and currently this year we've served 9. I would sort of point out the next sort of prohibition notice. This is pretty much a closing down the property. So if the conditions are so bad that there's a serious risk of to the health or sort of safety of the tenant, we can take the view that we'll close it down. So you'll see we closed down 2 properties in 1920. This year, at the time of doing the slide, we'd closed down 3, but I am informed that last week we closed down another one. So in actual fact, we actually closed down 4 properties in 2021. The other stick, which is the civil penalties, the sort of financial penalties. If a landlord doesn't comply with the improvement notices, well, there's other failures, particularly in HMOs, we can, as part of our enforcement regime, impose a financial penalty. Now, in 1920, we only served 1 because we're obviously in our infancy of it, but that amounted to £4,600. But in 2021, the current year, as I say, we've actually served 3, but the total amount of that is over £30,000. There are some appeals pending, but given the pandemic, those are sort of taking us much longer to get heard by the court than we would hoped. But as I say, it just gives you an insight as to the magnitude of these civil penalties if landlords don't comply. Just by word of sort of information, the maximum penalty that can be imposed is £30,000. So you can see the threat of these sort of penalties is quite significant to a landlord. Currently, we've got 33 properties where we've got work which is either in progress, notices recently served, or otherwise sort of say it's happening as we speak. The reason that doesn't quite match up is because some of that work we've associated with licensed HMOs. And to date, we have 9 live prohibition notices. Some of those will date back from previous years. Since April last year, we've had 162 dwellings been inspected, and within the action area, there's about 117 of those. One thing to note here would be that in actual fact, we're only finding what we would term actionable hazards in around 6% of those. So in terms of the numbers that are really problematic, the number is quite low. But what we are discovering, and particularly from recent inspections, bearing in mind with the pandemic impact, we are now finding the most serious hazards associated with fire safety and dampness. I'm rattling through this. I can't see you, so I don't know if there's any questions, but I'm sure you'll interrupt me if there's anything.
Howard, as soon as I get a question, I'll interrupt. Thank you.
Thank you. It's a bit off-putting when I'm talking to my presentation. I can't see your charming faces.
You carry on.
Right. And just now to sort of give you a sort of a flavour for where we were with the pandemic, because as you've appreciated for your previous discussions this morning, it's impacted on so many things. But basically, the government gave us some advice as to how we should deal with enforcement in the private rented sector through the pandemic, which meant we did a revision to our enforcement policy, which kind of adopted a more sort of a pragmatic approach. So that we clearly weren't going to be enforcing sort of legislation if there was contractors, etc., weren't available. But it was always safety led. So I think sort of it's been relatively successful because, as I say, many of the landlords have come to us to ask for our advice, which has been quite encouraging. We had to be aware of the government's sort of pandemic restrictions meant that there would be a very limited availability of contractors, which was certainly the case in the first lockdown. But the emphasis was on statutory compliance, so gas safety, EPCs, electrical safety, etc. Our inspection regime was all sort of based on detailed risk assessments. So obviously we weren't inspecting properties where it was identified that it would be high risk. What we have now found, and I must admit, we've had so many lockdowns, I've got how many we'd had, but in actual fact, what I mean is in lockdown 3, there's some resistance now because we're finding that people are in some ways more resistant to us doing inspections. And I think that's partly because the schools have been sort of, closed. So a lot more people have had children at home. So it's been quite difficult to arrange inspections safely. We're obviously continuing with our sort of pragmatic approach. But obviously we've got an eye on the 21st of June as to when we might be able to sort of, get up to full capacity. Our plan is that we would be aiming to do about 10 inspections a week. That would be 10 sort of buildings a week. So quite a sort of significant increase of the programme that we've been able to do over the last 12 months, that's for certain. We continue to monitor, obviously, contractor availability. because that's something which is key for landlords. Because if they can't get a contractor to come and do the work safely, then it's unrealistic for them to expect them to do the work. So we just have to be a little bit careful as to how we, how they say, undertake our enforcement. It's been mentioned a couple of times this morning about the unpredictable impact on the sector post-COVID. Obviously, the ban on evictions is scheduled to come to an end, although I understand it's just been extended. But I don't think we can underestimate really as to what the impact's going to be. And to pick up on one of the questions you raised earlier about what's happened to the no-fault eviction proposal, it hasn't actually disappeared. It was actually the government's consultation closed in October 19, and they still have made a commitment to bring forward legislation to end the no-fault eviction. As to where that is in the parliamentary sort of programme, we don't know. But we are conscious there's a couple of private members' bills which they may or may not support to bring that in. But clearly, if it happens, as I say, I'm sure we'll bring it to your attention.
Thank you, Howard. Can I just interject?
Rent with confidence.
There's a question from Councillor Willis and a question from Councillor Tucker. Councillor Willis.
Okay.
Thank you, Howard. Nice to see you, but you're gone now, so I did have you frozen. So under lockdown, this frozen person here, under lockdown, the issue is, and I've got a resident at the moment, end of private renting tenancy is coming at the end of March, and this person is trying to view properties, you know, on our housing list. And even though the properties are empty to view and found some suitable, is being told they can't view it because we're in lockdown. So if someone's going to be homeless at the end of March, but they can't view a property to get there, is that right? Or what's happening with that? I'm a little bit concerned as well as confused, and I have been trying to help, and I'm going to email you to see what you can do on it. But where do we sit with that, Howard?
Great question.
That's not my understanding of the sort of the market. I think you know, you'll be aware that the estate agency business is still running. There's very prescriptive guidance as to how they operate viewings. I think many of them be done obviously remotely, but certainly with empty properties, there's no reason why they can't be sort of viewed. But yeah, I'm happy if you want to email me afterwards, because, you know, I think one of the slides later, you'll see that throughout the pandemic, we've been creating new tenancies. So I'd be very surprised if they've been told they can't sort of view, but by all means, yeah, email me and I'll either deal with it or I'll refer it to a colleague.
Thank you, Chairman. I'll email you later, Howard. Thank you.
That's great. Thank you. Councillor Tucker.
I look forward to that.
Councillor Tucker.
Thank you very much, Chairman. Thanks very much for this, Howard. This brings me back a couple of years ago when I was on the panel, and I was pleased to hear part of the western end of Milton Ward's now been included. And you probably remember me lobbying for that when I was on the panel then. Would you be able to let me know which roads? I think you were on about, perhaps at the time, up to about Birchwood Avenue area, somewhere like that, as probably the cut-off. I don't know what's happened, obviously, since I've not been on the panel. And just as a second question, I was taken to task in my fire authority report on Tuesday night by a couple of members asking about cladding. I don't know if that's come within your remit at all, in terms of the areas you look at. Obviously, private high-rise buildings are the main concern at the moment nationally. But if there's anything you can report that I didn't know on Tuesday would be very useful, and I'll pass that back to members. And I'm trying to get hold of a report from the Deputy Chief Fire Officer that I referred to in a question reply to Councillor Gibbons. Anything you've got on those 2 points, please.
Yeah, sure. Yeah, the first one. What I'll do is I couldn't add it to the presentation. My IT skills weren't that clever. But what I will do, I'll circulate to you the map, which sort of kind of you can then see the exact boundaries of the area. So it shows exactly which streets, which sort of will help you. Yes, on the cladding issue. Sorry. Pardon?
Sorry, Howard. I do recall that map from a couple of years ago. So it's obviously expanded to include part of my ward. Excellent.
It hasn't. Yeah, it hasn't changed. Yes, yeah. Yes, on the cladding issue, yeah, I'm very much involved with it. And I was aware that there was a motion at full council Tuesday, and I have offered to the chief executive to offer some help with that referral to SPED. But I've also made a suggestion that sort of they may want to link up with members of ASH as well, because these are people's homes. So obviously and it's not solely a planning issue. So I think from my reading of the motion, it was a bit broader than just sort of planning. But yes, I am sort of involved. And you're right that the government's focus has been on high rise. But the focus is also now switching towards anything what they term it over 11 meters. But as I say, I don't want to take up any more time on that one today. But yes, it is something I'm heavily involved with. But I can engage with you outside the meeting if you wish. Yeah.
Thank you, Howard.
Is that okay?
That's brilliant. Thanks, Howard. Thanks very much for that.
Thank you, Chairman. Sorry.
Chairman, could I just provide a bit of update, unless you're already about to do so, if it's about the same issue? I was just going to give a bit of an update from the SPED point of view, as vis-a-vis the cladding issue.
I think I've got Councillor Hugh James coming after Councillor Havison. It may well be that Councillor James wants to touch upon that issue as well. Can I just bring in Councillor Havison for her question? And then, as I say, if you come in after that, Leo, please.
Of course, Chairman.
Havison.
Okay, thank you very much. Yes, I'm very glad to hear that the Security of Tenure Act is still somewhere in the pipeline, because I think it's incredibly important, because it ups the whole standards of the private rented sector if people have more security of tenure than they currently have. So yes, I hope I get an update on that very soon. As you know, my other passion is the energy efficiency, and it's linked to fuel poverty and poverty in general. And I was just wondering whether through our landlord registration scheme, you could see a way in which we can link landlords together and sort of introduce economies of scale into some of their projects, i.e. if several landlords get together and place a contract for double glazing or insulation or loft insulation or whatever it is, usually the costs come down. And I was wondering whether we could use this the scheme that we have to put landlords in touch with each other and get that sort of thing off the ground.
Yes and no, I suppose. They are quite a sort of disparate group in many ways, but we are working with the whole of the sort of the private sector in relation to capturing sort of perhaps economies of scale, as to focusing on the private rented sector. Yeah, we have what we call a private sector housing forum. So we kind of are working with those sort of members to sort of kind of promote to them what they should be doing. But as to it's quite a complicated area of procurement. So of course it's sort of, and for the local authority to embark upon it. But I'll give that some thought and share it with some colleagues and see if there's anything which we can sort of capitalise on in sort of, as you say, encouraging them to improve their properties. Yeah.
Good idea, Karen. Good idea. Councillor James.
Yeah, I just wanted to thank Howard. He's been so helpful in the cladding work, and the 5 residents associations here have really valued his comments and help. just on the cladding motion that's going to SPEDA. I think, well, Leo will probably have more to update than me, which is why it would be sort of useful for him to go first. But just actually, Leo, do you want to go first? Because you might preempt what I have to say. Go ahead, Leo.
It was really just to update members. Picking up Howard's point, I have had a discussion with the chairman of SPED, and he is minded that this may be a bit of joint work. I understand that he's in the process of writing to yourself, Councillor Crosby, just as a preliminary basis. But I think the idea is that there may well be a bit of work involving both panels.
I believe that's the case, indeed. Yes, yes, and we will respond accordingly. Right, Howard. Sorry. Please take us to the conclusion of your presentation.
Okay, we're back in the room. Yes, it's just this is what is the rent with confidence. This is something which operates across the west of England, and it's a scheme which sort of basically endorses various accreditation agencies. So certainly we found it sort of very valuable because it does include minimum property standards. I can send around a link to the actual to the site, so you can look yourselves as to sort of what's on there. But it's the usual things in relation to, you know, sort of the facilities, repairs, etc. We're very fortunate as we have what we call the National Landlords Code of Excellence, which is a locally based accreditation agency, and they've been working very hard in the background to recruit members, and they currently have 91 members covering over sort of, let's say, 2,000 properties. It's been a bit unfortunate because obviously the COVID has impacted on their recruitment, because all landlords have to undertake a mandatory one-day training, which isn't that practical to undertake remotely. So they've their membership has kind of just stalled at the moment, but they're hoping to, obviously, once COVID's over, they'll carry on recruiting. One of the things we were very keen on is that they have a very robust membership criteria that landlords have to sign up to, which does include expulsion. So obviously we felt that was important, that, you know, landlords don't hide behind it, and that if they don't sort of, you know, comply, they basically are thrown out. I've mentioned about the sort of some remote training is carried on, but not obviously the full one-day training. We are also sort of something which we'd spoken to them about previously, is we're actually introducing some randomised inspections. This is where the council will choose random properties or random landlords and pick some of their properties to go and do unannounced inspections of. I think that will give us some reassurance as to the sort of the quality. The other area which I think is important to flag here, and I'm sure my colleague Kay Eccles will sort of have mentioned it to you, but I think the council's lettings team have kind of done a tremendous job in recruiting new landlords. And particularly this has been helpful for obviously discharging the homelessness duty, which is now permitted obviously into the private rented sector. You'll see some statistics they've given me there. So obviously they work in bed spaces, but I think you can read that as being sort of tenancies. So they've obviously 700 bed spaces found. They've recruited obviously sort of about 50 landlords each year. A few months to go yet in 2021. As a minimum, they have to have the 12-month tenancy. They do offer small grants to enhance landlords to come on board, but many of the landlords go far beyond what is sort of necessary in terms of you know, minimum standards. They'll fit whole new windows, double glazed windows, Karen, and sort of new bathrooms and kitchens. So I think here, it's just to flag again, the good working relationships we have with, the good and well-intentioned landlords, and they are responsive in terms of our requests to find more accommodation. Fundamentally, right at the beginning, the Chairman, you said that what this is about is obviously sort of where are we with our area action, and I think it's just to highlight that the legislation lays down a very clear requirement on local authorities to keep housing conditions under review, and that's something we continually do to be able to see, well, okay, where are we in terms of housing conditions across the whole of the stock, and primarily that would be how we would do that would be through a stock conditions survey, which we last conducted in 2017, which was all the information we used to actually undertake that review of housing conditions, which I mentioned back in 2018. The information we get can report down at ward level, but in some locations it can actually go lower than that. It can actually go not so much street, but down to postcode level, which is quite helpful when you're sort of planning as to where you should be your interventions. The EPC data is also quite valuable because obviously that gives you a whole sort of host of information in relation to the energy performance, and sometimes it can help us to target fuel poverty work. We can feed in our local enforcement data, which kind of again further enhances the quality of the report. We have picked up that sort of, as I said, through the lettings team, that many landlords have actually voluntarily been doing improvements because the EPCs are now a requirement that they have to improve constantly, because I think the next date for them is 2025, when the EPCs will actually move to D. So anything less than a D won't be able to be let. It's currently only F and G. Just a sec. Obviously, a stock condition survey or report would be a useful tool in obviously the refreshing of the housing strategy, which is scheduled for this year. We have received a couple of chunks of funding from the government in terms of road landlord funding, and that's been really helpful, particularly in trying to find some of the holiday accommodation, which we think in the area action has been converted into residential, and that's been useful to sort of kind of to track those properties and then get the necessary improvements. So in conclusion, and just to be clear, that when we embarked upon the area action, it was always the intention that we would plan reviews, and I think we had, as I say, scheduled one in Q1 this year, but obviously the pandemic has kind of seriously impacted on what we've been able to do. So obviously it's pushed things back a little bit. But just to be sort of clear about it, we certainly now have the comprehensive data as to where the properties are. We've concluded what we would term the information and the advice phase of our action. And obviously, despite the pandemic, we have now been able to do quite a number of inspections. And I think we're beginning to sort of get to the real rogue landlords, because that's what we're finding, the increase in the prohibition orders being sort of served, because that's telling us that these are quite seriously, defects in the properties. Once again, as I say, the number of good and well-intentioned landlords should be acknowledged, and obviously the work of LCE. The refresh of the stock condition survey, again, I think would be helpful, not only for the housing strategy, but I think to gauge as to where we are in terms of the condition of the private rented stock. That could be sort of factored in, as I say, towards then to the end of Q3, which would certainly allow us to the pandemic recovery plan to be implemented. I'm making the assumption here that obviously Boris's plan for the 21st will. Sorry, was there a question there?
No, it's
maybe some feedback.
Conclude, Howard, and then we'll come to questions.
Okay, yeah. So obviously, I will send round the actual a link to the road landlord reporting methodology we have on the council's website, and again that has been valuable because people can actually anonymously report any concerns they've got about properties. And I've just enclosed that picture there because surprisingly the Knightstone Island has got quite a lot of privately rented accommodation, and that's me finished. So yeah, any questions?
Thank you very much, Howard. You know, it was well worth the long wait. It was not your fault in the slightest, but we did have that pandemic thing to deal with. Councillor James.
Yeah, thank you so much to Howard and your team, and to NLCE, is that it? The Landlords Association. I think a lot of us members were very anxious to get this reviewed as soon as possible, but with your explanation and with the answers to the questions you gave earlier, it's been really helpful to understand. I think we would still be anxious to review this when we do have enough data and when there is enough time, but it's very clear that that's not quite now. So just acknowledgement of how hard you're working. I've seen the benchmark data of this authority compared to other authorities, and we are doing very well to tackle road landlords, but also the fact that landlords in the authority are themselves doing very well to self-regulate has been very helpful. I'm someone who's very suspicious of self-regulation quite naturally, just due to my past experience, but I'm going to get the acronym wrong again, NLCE have done a very good job from what I've been told and what I've seen. So just that bit of feedback. Or put my hand down rather than up.
Right.
There we are.
Thank you. Any other comments, questions from members? Okay. Well, at that note, I will say thank you very, very much, Howard, for your efforts, your contribution, and so forth. As I say, long awaited.
I think. Sorry. I think for me. Sorry, just to say, I think for me, what would be helpful to you, just to be. I've obviously referenced the stock condition survey, so clearly there is a cost involved to that, but I feel that it would be a very useful, sort of report to obtain, because clearly it's 4 years since we did the last one, so it just really, sort of if the panel felt they would support me sort of going forward to, liaise with the various managers and, exec sort of on this subject, then that would be helpful.
Well, Councillor James leads the housing issues group within the panel, and I think it would be, when we met before to discuss it in our earlier conversation, that was something we would be very interested in progressing.
Yeah.
Right.
Thank you.
Thank you for your time and efforts. Thank you. Right, members.
Thank you very much.
No problem. Right, members, we'll move to the work programme. It's not going to take long. You'll be grateful for. There's just a couple of points that I wanted to make at this stage with regard to where we are on the current projects. The planning policy in relation to housing for vulnerable people and so forth is progressing well. We are at a point now where we are aligned with the emerging local plan and what's coming out of that. We know from our discussions with Michael Reep and Claire Courtois that they are happy to start composing the draft that will form the basis of the policy. And I've spoken with the chair of SPEDA to agree that once we have agreed what we believe the policy should capture and condition, that we will pass it to them for them to have a look at before it goes back to the actual local plan group. So that's in a nutshell where we are on that one. Any questions on that? No. Right. On the unpaid hidden carers review, the carers inquiry, we've been a little bit delayed and been shifting dates to some extent, because what we wanted to be sure was that we were responding to evidence based on COVID results. And that's where we're driving at the moment. What we want to do is to come back in the near future with a framework for that inquiry day to put before you. If there are members who would like to be involved in that planning stage, it doesn't need a big framework. It's just if there are a couple of members that want to participate in that planning for the inquiry day, then very, very happy to have your participation. So at that point, I'll turn to Hugh.
I'll put my hands down if anyone has any comments specifically on that. If anyone has any comments specifically on that, feel free to butt in.
Your hand is up on mine.
Oh, I've got a hands up, but if anyone wants to feed in specifically on carers.
Right. Can I speak to Councillor Willis?
Yeah, Ros will do. Thank you. Thank you. I know because of COVID, all this is delayed. So maybe part of that planning, I would like to be part of that planning group. Now I've got access or some access, which I didn't have before. But maybe because of the time limit, and even though it's desperate, we do it, but we need information after lockdown to be able to do that work. Perhaps you could link it to National Carers' Rights Day, which is normally the first Friday in December, I believe, out of memory, if it's still there. And we could do a whole piece then, along with council, some of the voluntary sector. It could be an actual inquiry day that is wider than just a few people that were there. We could almost, like we've done before, we took over the council chamber and we've taken over Somerset Hall in Portishead and done a Carers' Rights Day to bring people in and do some of that work there. I'm just wondering if, to throw that in. I know it's December, but I don't think we're going to have that much time between now and December to get you the evidence back that you want on research. And I'm just wondering.
I'm very grateful.
I would like to be on the group.
Yeah, I'm very grateful for your input on that. Before I come to you, Councillor Havison, Leo, am I right in thinking that we have a meeting tomorrow, a planning meeting tomorrow regarding the inquiry day?
That's correct.
Would you send Councillor Willis the link to it, please?
Very, very happy to do so.
Thank you very much. And I'm very happy that you're doing that as well, Ros. Thank you very much. Councillor Havison.
Yeah, I'm sorry, my comment actually relates to the previous agenda item. I was just a bit slow to raise my hand. So if anybody wants to comment on this particular item, then I'll wait until right at the end. It's probably inappropriate to jump into the middle of this. So if there are any other comments for this item, then I'll shut up.
Right. Okay, if we just hold fire on that one a moment, I just wanted to say to members, is there any aspect of today's meeting that members feel merits further scrutiny? I do not need an instant response to that, but I would be grateful for your comments back on that. So,
if it's okay, Chair.
Sorry?
If it's okay, Chair, I've written a note of when members during this meeting have said that they want something to be referred to the work plan. We have digital strategy. We have digital access and inclusion, which could probably link to the digital strategy for North Somerset Council that's coming up.
Yep.
So that's one thing. There's also Home for Hospital and the Red Cross issue that Councillor Harley raised. That's another. There are a lot. So there needs to be.
I think what we need to be careful with, members, is that it's sort of not whims and wishes, not grabbing something out of the air and saying let's do something on that. What we need as a panel is for a member who wants us to scrutinise or explore some other aspect of ASH, then what we need is a sensible, straightforward briefing note from that person to say, this is what I think the issue is, this is what I think the wider issues are, this is why I feel it should be considered for scrutiny, and these are the outputs that I would hope to achieve from it. So rather than, as I say, it's easy to have the whims and wishes process, but we need more substance to it.
I've put in text the things that people have said that they wish to put in the work plan, and it's a lot. So I think you're right in terms of
Yes. And
prioritisation.
Ross, you wanted to speak again?
Yes, thank you. Just on that about saying about your meeting, I'm just very aware that Howard sort of made a plea to us on the panel,
yes,
for some support, which you gave verbally, but maybe you need to look at making some sort of recommendation via Hugh, etc.
Yeah.
Because he's asked for, you know, support and help. It's going to cost some money to do with the housing strategy and the stock list bit. I've lost my note now. I can't see where I'm going. And I'm just thinking perhaps you need to have some sort of recommendation to the executive to back that up. Otherwise, it's going to waver until you get to a working group, and then it's got to come back. And if it's desperate to be done, which it obviously is, maybe you need to do it on here, Chairman. It's just a thought.
Kind advice. Thank you very much, Councillor Willis. Thank you. Yes, it is good advice. And I know that Hugh does have it at the end of his sort of pen tip, so to speak, in terms of that, because it was an issue raised by Howard to the both of us prior to this particular panel meeting. Okay, right. It's been a long meeting. As I said, I make no apologies for it. 3 mornings a year is not enough during a pandemic. It really isn't. But that's something that maybe I need to stamp my feet about with the exec, at least for this extraordinary period in our lives. But thank you so much for your input and your good humour and your guidance and advice. I'm most grateful. If there are any other points anyone needs to raise, Leo, is there anything else that you need to raise?
No, I think that covers it from my perspective.
Sorry, Karen, I promised you to come back to that particular issue that you raised, so please take the floor.
Okay, thank you. Yes, I know everybody's dying to get home now. I apologise. No, the issue that bothers me is how our local plan links to our accommodation for the elderly from the previous agenda item. And I was wondering, obviously there's a great need, but there's a great local need as well. And what worries me that after this pandemic, there'll be a huge rush of people wanting to retire into the countryside. And I'm just wondering whether there's anything we can incorporate into our local plan or our accommodation strategy that actually gives local people priority on accommodation, which we provide. So it's just something that I'm not a NIMBY by any means, but I just feel that there's so much local need for accommodation, and it would free bigger houses for families if our elderly people had easy access to retirement accommodation, and we gave them priority.
As you're probably aware, that's where much of my professional life sits on that issue. I'd like to come back to you with a proposal to begin to explore that issue in a bit more detail, allied to the current work we're looking at with respect to the local plan on planning policy related to older and vulnerable people, and we can take it from there. Happy to put a group together on that so that we can discuss it in a bit more detail.
Imagine the joint housing needs assessment linked into that, so that could probably be a further discussion on that.
It's a good thing. Really good thing. Really good thing. As I say, thank you for your indulgence and your good humour and your time and effort. I'm most grateful. Leo, at this point, can I declare this meeting closed?
You can indeed. You're chairman.
This meeting is closed. Thank you.